Hello, I'm Ahmed Muttalib, Associate Professor of Avian Pathology at Mississippi State University. I'm going to share with you my experience in pathology of avian diseases. I'll present information by system, pathology of the digestive diseases, respiratory, so forth. All what I want you to do is sit back, relax, and enjoy the presentation. I'm going to start with diseases of the digestive system. First are diseases that are characterized by erosions or diphtheritic membranes in the oral cavity. These can be caused by nutritional deficiency, a variety of infectious agents, or chemical irritations such as quaternary ammonium in the drinking water. I'm going to go over some of these in more details. Here is a chicken from a backyard flock. What you see, nodules, yellowish nodules in the oral cavity and extend into the esophagus. Here is another view where you can see the nodules, pimple-like nodules extending from the oral cavity in the esophagus and then into the crop. Histologically, it is a section of the esophagus. It's characterized by squamous metaplasia and keratinization of the mucous gland. This is a classic example of vitamin A deficiency. Vitamin A deficiency is commonly seen in backyard flock of chickens, particularly when they are fed on single ingredients such as wheat only or barley, and they have no access, birds have no access to a source of vitamin A. As I'll show you in the coming slides, that vitamin A affects multiple systems. We will see vitamin A in the respiratory, in the digestive, in the bursa fabriceus, in the kidneys, in the bones. It is a wild turkey with nodules of various stages of development on the skin, as well as yellowish brown caseous material lining the oral cavity. It is another view from another bird where you can see still the nodules on the skin and the caseous material lining the mouth. Histologically, you can see ballooning of the cells. There is a section in the oral cavity, and ballooning, degeneration, and large intracytoplasmic inclusion bodies. So this is a pathognomonic lesion of pox. Bowel pox is caused by pox virus. The virus is mechanically transmitted to injured or lacerated mucous membranes. Mosquitoes and other blood-sucking arthropods can transmit infection. Pox has also been described in turkeys and turkey hens following artificial insemination. Here is a crop from turkey. You can see that the lining of the crop is roughened, thickened with this yellowish white diphtheritic membrane. Histologically, you can see mycelia invading the crop epithelium. So this is a crop mycosis or candidiasis, moniliasis, has different names. It's commonly seen in birds that are extensively treated with antibiotics or other chemicals that disturb the microflora in the crop. has also been associated with unhygienic conditions whenever the bird is overwhelmed by large numbers of these yeast-like fungi. Some of these lesions, as we will see, they can overlap. They look very similar to each other grossly, and that's why we have to do some further laboratory tests, blood smears, or histopathology. That lesion in the crop can look very similar to infection with Salmonella typhimurium in sparrows. Very similar diphtheritic membrane. Here is another one that looks very similar. Here is a crop from a quail. Again, the crop lining is thickened and roughened by this yellowish white diphtheritic membrane, caseous material in the crop. If we say this is a turkey, then we put the first on the top of the list of differential diagnosis, perhaps candidiasis. But if we say quail, the list is slightly be different. And here we're talking about capillariasis, crop capillariasis. Here is another view. There is a normal crop, and here you can see almost you can see through. It is thin. Here is the crop from that affected bird. You can see it greatly thickened and lined with this caseous material. Like as I said before, they can look very similar to crop moniliasis, maybe similar to vitamin A. That is why we have to do further laboratory tests. Smears like this one will show us that the characteristic appearance of capillary eggs with these two plugs, or we can make a histopath. You can see hypertrophy, hyperplasia of the crop epithelium and cross section of the parasite. Obviously this is a female. You can see the cross section of the eggs. So this is a crop capillariasis. We commonly see it in a quail, on necropsy, when we do either sick or healthy birds. So I don't exactly know the significance of this lesion. Sometimes you see it very advanced lesion in very healthy, good body condition, birds with good body condition. So it may not be very significant. It's caused by capillaria species, can be seen in other species as well, in addition to a quail, but it seems that it's very common in a quail. Excuse me. We're looking at the crop and gizzard from broiler chicken. The one in the middle in the center is normal crop, normal gizzard. The one in the left and right are enlarged proventriculus, the same thing here. When you open the proventriculus on gizzard, here's the gizzard, the proventriculus is filled with food. Here is another shot where you can see here is the normal proventriculus on gizzard. Here is the one with dilated, enlarged from outside. You can see it's greatly dilated proventriculus. Also, we can notice that the wall of the gizzard is thin relative to normal gizzard. This is called proventricular dilation. Is seen in broiler chickens and is generally considered due to poor development of the gizzard musculature due to feeding finely ground feed. Feeding grit seems to help the muscle of the gizzard and thereby reduces the amount of backup of feed into the proventriculus. Recently, infectious agent or agents have been isolated from crops with a proventricular enlargement it should not be confused that proventricular enlargement can be due to dilation of the proventriculus, as I showed you, or it can be due to thickening of the wall of the proventriculus. Thickening of the wall of the proventriculus can be due to either Merrick's disease or due to hypertrophy and hyperplasia of the glands, mucous glands of the proventriculus, and that's where they isolated several infectious or various infectious agents from proventriculi that have thickened wall. Looking at here is proventriculus and gizzard from chicken. You can see petechiae and ecchymotic hemorrhages on the lining of the proventriculus. These hemorrhages are not specific and can be seen due to associated with a variety of infectious diseases: Newcastle, influenza, duck plague, mycotoxicosis, vitamin K deficiency, and a variety of bacterial septicemias. Here is proventriculus and here is a gizzard from a broiler chicken, commercial flock. And what we see here is deep ulcerations and necrosis of the gizzard lining. Gizzard erosions and ulcerations are again more or less common in broiler chickens. They can be due to again a variety of causes. Excess copper sulfate in the diet can be one of them. Copper sulfate is widely used feed additive, presumably as anti-fungal agent. Erosions and gizzard erosions and ulcerations has been described in association with black vomitus, mycotoxicosis, and quaternary ammonium in drinking water. You may notice I'm going slightly fast, but I'm trying to show you as much as I can on this videotape. I thought you may pause the video or review it at your convenience. I'm trying to show you as much as I can, however. Looking at the small intestine from a turkey, the intestine is filled with kind of dark brown blood. This is a turkey. It is histologic section of the small intestine. You can see necrosis of the tips of the villi, massive hemorrhage between the villi, higher magnification. You can see intranuclear inclusion bodies. These inclusion bodies are so large and pushing the chromatin of the nucleus to the side, so appear very characteristic appearance of these inclusion bodies. This is called hemorrhagic antridis in turkeys and is caused by type 2 adenovirus. Is closely associated with adenovirus that causes splenomegaly in pheasants and splenomegaly in chickens and marble spleen in pheasants. Here's the intestine, small intestine, large intestine of from broiler chicken. Very characteristic appearance. You can see that the intestine here is kind of distended with this turbid yellowish brown fluid. You can see the intestine here lined with this yellowish diphtheritic membrane. Here is a higher magnification of that. You can see that turbid fluid, the lining of the small intestine here. Histologically, you can see necrosis of the villi of the small intestine, a sharp line of demarcation between the dead necrosed tissue and between the viable tissue. There are some clusters of bacteria in here and infiltration of mononuclear inflammatory cells between the villi. This is necrotic enteritis, commonly or can be seen in broiler chickens, occasionally in turkeys and geese, caused by Clostridium perfringens type A or C, or its toxin of Clostridium perfringens alone can induce this condition too. Necrotic enteritis is often accompanied by or predisposed by infection with coccidia. So coccidiosis is a common finding with necrotic enteritis. Necrotic enteritis has also been described or occurred in broiler chickens that have been fed high levels of fish meal or wheat in diet. Looking at a quail from commercial operation, it is the small intestine. You can see these white spots from outside, from the serosal surface of the intestine. It is a higher magnification of that one. These are ulcers that can be seen from outside of the from the serosal surface of the intestine, and cut it through. You can see them from the inside as well. And this is a classic example of ulcerative enteritis of quail. Histologically, the necrosis and ulceration goes deep down into the intestinal wall, can perforate the entire thickness of the intestinal wall, unlike necrotic enteritis, where the necrosis is only at the tip of the villi. Ulcerative enteritis is common in a quail, and that's why it's called quail disease sometimes. In addition to ulcerations of the intestine, sometimes you see foci of necrosis in the liver and sometimes area infarcts. It is a higher magnification of the infarct in the liver and the areas of foci of necrosis. Ulcerative enteritis is caused by Clostridium cholinum. For confirmation, we prefer to have the liver for bacterial isolation, and whenever suspect Clostridial infection, we advise to request anaerobic culture. Otherwise, it's not routinely done, and the results may come negative. Looking at here is the intestine from broiler chicken, from commercial operation. The intestine is what you see in here, large numbers of long ground worms. These are the ascarids, Ascarida galli. We don't consider them very significant unless they are present in large numbers. They may cause physical obstruction or may interfere with digestion. Another Ascaridia is Ascaridia similis, affects young turkeys, causes more severe lesion, more necrosis in the intestine, mostly by the migrating larvae. And bacterial infection may contribute to the intestinal bacterial bacteria may contribute to the lesion. Quite often we see nodules in the liver, large nodules in the liver with a cross section of the parasite in them, particularly in turkeys. Looking at a ceci from chicken, broiler chicken, and see these small round worms. These are Hemorrhagic Antridis. Again, we don't consider them very significant to the bird, but they are they have one significance, and that is they can be carriers of Histomonas miliaridis, which is the causative agent of histomoniasis, or commonly known a blockhead. Here are a ceci with nodules visible from the outside. In pheasants, this is due to Heterachus isolans. Histologically, it is a cross-section of the cecum. You can see cross-section of the parasite here with a large number of masses of fibroblasts around them. They run in different directions, and their appearance suggests sarcoma. Heterachus isolans in pheasants. Capillaria is again common in both backyard flock as well as in commercial operations. They infect the small intestine, and basically the small intestine, the intestinal wall is kind of thickened, and the lumen is distended with fluid. It is small intestine, broiler chicken, and can see large numbers of segmented parasite. These are tapeworms. Again, we don't consider them very significant or important. We don't treat for them. However, we pay attention to the intermediate host. Intermediate host can be fleas or flies, and here is a mealworm in the crop, which can be an intermediate host for this parasite. Heavy infection with tapeworm may interfere with digestion or cause intestinal blockage. And I listed here some of the intermediate hosts of the parasite. Looking at the broiler chickens, this bird and these two are the same age. They are from the same flock. This condition has been given different name: infectious stunting, grunting syndrome, pale bird syndrome, maldigestion syndrome, malabsorption syndrome. All what we see are these birds are smaller than the normal mates. When do necropsy, it is a normal pancreas, but pancreas of affected birds may look smaller, may appear smaller and chalky in appearance. And that is why some people think it is a maldigestion, because the pancreas is not functioning properly. Some people say no, it's the other way. It is it's malabsorption, and then pancreas atrophy is secondary to that. When you open the intestine, you may notice some undigested feed in the intestine. A variety of viruses have been either isolated or demonstrated in intestinal contents, and the condition has been reproduced using the intestinal content or a mixture of the viruses. No single virus the disease has not been successfully reproduced with any of the viruses alone, but in combination it can produce the condition. Looking at a ceci from a chicken, backyard flock chickens, with lumps or nodules on the cecal wall. These, again, just from the picture, it doesn't tell you very much whether this is neoplasia, whether it's TB, Chole Granuloma. It's hard to tell without having more history and more about distribution of the lesion. Here is a higher magnification, as you can see these nodules on the serosal surface of the cecum. Typically, these nodules are seen or confined to the ceci and liver. This is called Chole Granuloma. Chole Granuloma histologically is characterized by typical granuloma in the cecal wall. That is acid-fast negative, so it's not TB. As well, it is PAS negative. On a gram stain, you may see some gram-negative and gram-positive bacteria because E. coli is commonly isolated from these birds. It is often called Chole Granuloma. However, in majority of cases, no organism is being isolated. Chole Granuloma is also called the Irish disease, seen in backyard flock of chickens. The pathogenesis is not very clear, but it is being suspected that mild or suggested that mild intestinal damage, such as those caused by mild coccidiosis or mild intestinal worm, cause some irritation in the intestinal lining, and bacteria penetrate through the wall and initiate that nodules in the cecal wall as in the liver. Currently, we advise people with these are commonly seen at a slaughter whenever they kill the birds and found these nodules. What we advise is if the bird is in good body condition and these lesions are confined to the liver and ceca, we advise to discard the liver and ceca and pass the carcass. If the bird is emaciated and if the lesions are widespread, we advise to condemn the whole bird. Looking at intestine from a backyard flock of chickens, the bird is 10 months old. Chole Granuloma is commonly seen in young bird. Typically, when we say these are 10 months or 1 year old, and you can see granuloma on the serosal surface of the intestine as well as in the mesentery, number one, a differential diagnosis will come TB. TB is caused by Mycobacterium avium. Infection is by ingestion rather than by inhalation. Is unlike TB in other species of animals where the respiratory infection is the common route of infection. Here is enteric infection. Mycobacterium avium has been isolated from people with immunosuppressive syndromes, people with AIDS. That's why we always we carefully monitor birds with nodules. We carefully handle these cases. Eggs from birds with TB or from birds from flocks with TB, we don't recommend feeding these for a human. It's not because that TB is transmitted inside the eggs or is not going to be killed. Yes, it will be killed by cooking or frying or boiling, but whenever there is intestinal lesion, there will be ulceration of that lesion, there will be shedding of the mycobacterium, which is going to smear the eggshell. So there is a potential chance of human infection. That's why we don't recommend using these eggs for human consumption. Here is liver and ceci from a game bird. It's a pheasant. The cecal wall is thickened, is ulcerated, and is filled with this caseous material. It's called caseous core or cecal cores, and there is a little bit of a blood mixed fluid in the lumen here. I'll come to the liver later on when we come to diseases of the liver. And here is the combination of the two gives you, or the liver alone, gives you the characteristic appearance of histомoniasis or blockhead. We're talking about the digestive system here. If I show the ceci alone like this, you can see the cecum is greatly distended, the wall is thickened, filled with this caseous core. Yes, it can be due to histомoniasis, but it can be caused also by mild infection with Amelia tenella, with coccidiosis. Can be caused by recovered birds from Amelia tenella infection. And we also see it in young birds, with young poultry with salmonella infection. Histologically, it is a section of the cecum, a little bit of normal one. You can see an ulcerated area in here. You can see these clear spaces with these round pink bodies. These are the parasites, the protozoa, that is Histomonas meleagritis. It's common in game birds, and as I mentioned before, the cecal worms of chickens can act as transport hosts. Similarly, earthworm, whenever earthworm pick up eggs of Heterachus that are laden with Histomonas, the earthworm become a source of infection to game birds or turkeys, and it becomes evident whenever we have rainy weather. So many earthworms appear, and birds will have a chance of getting infected if these earthworms carrying that parasite. As I mentioned before, differentiate the cecal lesions from salmonella infection or Amelia tenella. Going down the digestive tract to the intestine, by far is a very important disease in that area will be chicken coccidiosis, protozoal enteritis. Just make a few comments about them. Eimeria is caused by Eimeria species. The Eimeria are host specific. In other words, Eimeria of chickens will not infect turkeys or vice versa. Eimeria of chickens or turkeys will not infect other species. It will not come in horses or cows. It will not infect a human either. Infection is by ingestion of sporulated oocyst. Sporulation of the oocyst takes place outside the host under suitable environmental temperature and humidity. Diagnosis of coccidiosis is by demonstrating large number of oocysts and intestinal smears. Smaller number of oocysts, just a few numbers, without much damage, without mortality, without damage to the intestine, is called or referred to as coccidiasis rather than coccidiosis. Here what I put is a mixture of a variety of oocysts. You can see here is a very large one. This is Amelia Maxima. These Amelia species commonly being the species comes after their location, their size, their histologic appearance, and so forth. Here is Amelia Maxima, a very large oocyst. Here is Amelia nicatrix. Here is two Amelia were taken from a small part from the duodenum. It could be a cervellana or mitis. Just before I show the lesions of coccidiosis, here are 2 feet. One is yellow, one is white, of broiler chickens, commercial operation. The difference in color can be due to diet. Commonly see white skin in birds that are fed wheat-based diet. They are fed wheat rather than corn-based diet, corn soybean diet. Some operations where their market demands yellow skin, they may also add keratin pigment, keratin granules to the feed. Occasionally, the keratin diet, keratin granules are present. The birds are on corn, but still the skin is pale like this one, and that could be due to intestinal damage, such as mild coccidiosis. There is malabsorption, there is impaired absorption of these pigments from the intestine. That's why the shanks of the bird, as well as the skin of the body, appear pale. Here's a gizzard, small intestine from a bird that was 14-week-old. Looking from outside, here is the duodenum where the pancreas is. You can see these ecchymotic hemorrhages, some petechiae hemorrhages. You can also see some white spots. Now, open it from inside, you can see that the intestine is distended with this bloody content, some shredded intestinal epithelium. This is chickens. Number 1 diagnosis would be coccidiosis. And the small intestine at this location, it is most likely Amelia nicatrix. Amelia nicatrix. Now, to confirm diagnosis, we usually make a smear in here looking for oocyst. However, with Amelia nicatrix, if you make a smear in here, you will not find the oocyst. The oocysts are found in the ceci. The reason for that is the macro and microgametes, although they are produced here at this location, but they will unite in the ceca. So the oocysts were not found in this area, but in the ceca. Also, Amelia nicatrix does not, we don't see Amelia nicatrix in young birds, in young commercial broiler chickens that are being raised to 7, 7.5, 6.5 to 8 weeks. We see Amelia nicatrix in older birds, maybe 15, 20 weeks or so of age. That gives us a little bit of idea to differentiate between Amelia nicatrix from Amelia maxima. Amelia maxima comes in the same location, in fact, the same location as Amelia nicatrix. So Amelia nicatrix infects the epithelial cells, deep epithelial cells. That is why it will cause rupture of blood vessels and cause hemorrhagic enteritis. Similarly, Amelia maxima and similarly Amelia tenella. They proliferate deep down into the crypt epithelium. I mentioned about these. Here is the 2 ceci. You can see them distend from broiler chicken, distended 7-week-old, distended with what looks like bloody content. From outside, you can see areas, white spots, areas of hemorrhage. You open, you can see the intestine is filled with clotted blood and dead tissue. This is a broiler chicken. Number 1 diagnosis would be Amelia tenella. making a smear in here, you can find the oocyst, and that's what confirms the diagnosis. Amelia tenella is restricted to the cecum. Again, because the parasites proliferate deep in the crypt epithelium, causes rupture of blood vessels and hemorrhage in the area. It's not a very good slide, but there's a small intestine filled with yellowish orange mucus. From outside, looks like petechial hemorrhages. This is Amelia Maxima, which infects, as I mentioned before, infects the same site as Amelia Necrotrix, but is less severe. Also, the oocysts are very large, as I showed you before, and are seen or can be demonstrated in the same location where the lesion is, and that makes difference from Amelia Necrotrix. Okay, looking at the small intestine, here is the duodenum. There's a little piece of the pancreas showing here. We can see areas of necrosis throughout the lining of the duodenum and part of the mid-intestine here. These areas of necrosis appear as white transverse bands. They are transverse bands, and this is characteristic for Amelia acervulina. It's a severe infection of Amelia acervulina. You can see them again here. Here's the duodenum, pancreas. You can see the areas of necrosis in the form of transverse white bands, but you can see them also from outside, from the serosal surface, as white spots. Amelia acervulina. It doesn't cause hemorrhage, and the reason for that is the protozoa proliferate at the tip of the villi, so it's not going to cause much rupture of a blood vessel or hemorrhage. It causes mild infection with or little mortality or no mortality at all. May predispose for infection with necrotic enteritis. That's why we always, with necrotic enteritis, we have to check for the presence of coccidiosis. If it is there, we're going to treat for both Clostridia as well as for the coccidia. Otherwise, if we miss one or the other, the bird will not respond to medication. I'm going to go through some miscellaneous conditions. We're looking at the small intestine here. Here is the pancreas. And we're looking at these red spots that can be seen from the inside lining of the intestine as well as from the serosal surface of the intestine. The intestinal lining itself looks clean, no appearance of inflammation or anything. It's very shiny, very clean. These are called red spots or red blotches, and they should not be confused with coccidiosis. They are commonly seen in both healthy as well as sick birds, commonly seen on necropsy. They have no significance at all, just must not be confused with coccidiosis. Histologically, they represent accumulations of erythrocytes and heterophils. So they may represent extra medullary hematopoietic focus, or they are not significant, should not be confused with coccidiosis. Here is a proventriculus. Here is a gizzard, chicken from backyard flock. What we're looking at here is a nail going through the wall of the gizzard, initiating some tarry black content on the outside of the gizzard. Sporadic individual birds, traumatic ventriculitis. occasionally seen in backyard birds. Birds do not discriminate in what they pick up, anything shiny or large. They pick it up, and unfortunately sharp objects can do them more harm. Here's the ceci. Here's the remaining part of the large intestine, and what we see in here is invagination of the ceci into the succeeding segment of the large intestine, and this is called intussusception. Again, the individual bird problem has no significance at all, except sometimes it appears on the exam. Here is a bird, a chicken with a dark red congested loop of intestine. The interior part of the intestine as well as the body is pale. This characteristic appearance of strangulation or torsion of the intestine. Again, is not significant, just incidental individual bird problem. Here is a turkey from a commercial flock with a large distension of the crop. And this is commonly called pendulous crop. Pendulous crop pathogenesis is not very clear. Several theories have been suggested. Excessive water intake in hot weather, paralysis of the vagus nerve, crop mycosis that causing weakness of the wall of the crop, or ingestion. Often these birds, when you cut the crop, you'll see it filled with sour fluid with a smell, and maybe the opening of the crop into the lower esophagus or proventriculus is impacted with litter material. Another suggestion was abnormal bacterial fermentation in the pathogenesis of pendulous crop. Is abnormal fermentation, bacterial fermentation, with the production of a voluminous amount of gas that causes distension of the wall of the crop, eventually its weakness, and then fluid and feed material stays in the crop. Looking at a small intestine with these areas of hemorrhagic necrotizing lesion, same thing here in form of bands. In ducks, this is characteristic for duck viral enteritis, commonly called duck plague, is caused by herpes virus. The virus attacks areas or sites of lymphocytic accumulation, which happens in the ducks, accumulate in form of rings or bands in the intestine, in case of the intestine. So when the virus attacks them, that's where hemorrhage and necrosis, that's why they happen in a form of band. I'm going to move from the intestinal or digestive tract to the liver. I start with liver nodules, granulomas. They can be caused by, again, a variety of causes. It can be caused by bacterial infection, parasite, neoplasms, viral diseases here. So I'm going to go over some of these diseases in more details. Here is a liver with large yellow nodules on one side, multiple nodules, conglomerate nodules on one side from a backyard flock of chickens. That is the same bird that we saw earlier, where the nodules are confined to the liver and ceci. In young backyard flock, the lesions were seen at slaughter. It is commonly referred to as Chole Granuloma. Histologically, here is a section of the liver characterized by typical granuloma. Again, that is acid-fast negative, PAS negative, so it's negative for mycotic or mycobacterial agents. Gram stain may reveal some gram-positive bacteria or gram-negative bacteria. And as I said before, because E. coli is sometimes isolated, this condition is referred to as Chole Granuloma. I talked earlier about the pathogenesis or the suggested pathogenesis of this condition, where there is intestinal irritation or damage that predisposes to liver infection. There are some similarities between this lesion and liver abscess in beef cattle. Beef cattle with grain overload causes ruminitis, damage to the intestine, and then mycotic infection of the intestinal wall. Bacteria will penetrate through these necrotic ulcerated lesions and initiate liver abscesses. So it's very similar to these liver granulomas in chickens. And as I mentioned before, the meat inspection, from meat inspection point of view, we treated them the same way as in beef cattle. Here is a liver from a backyard flock, 10 months old or 1 year old. You can see miliary nodules all over the liver, small and large nodules. Histologically, again, typical granuloma. Here's a section of the liver. With acid-fast, it is acid-fast positive. So we're talking about tuberculosis. And that's how we differentiate between these lesions. When it comes to necropsy, you'll see that TB, the lesions are widespread. It's not confined to the intestine and liver, but you will see it in other tissues as well as in the bone marrow, affects the bones as well. It's caused by Mycobacterium avium, and is infection by ingestion, and from there will be bacteremia and spread of the organism to various tissues. Typical history are these birds are emaciated, they are lame, they've been sick for a long time, so death after a prolonged illness. Usually, because it's a chronic, we see like eventual death of 1 or 2 birds within 3-4 days, another dead bird in 3-4. So it's continuous mortality, but of 1 or 2 of individual birds. As I mentioned before, that Mycobacterium avium can be transmitted to man. Here are nodules again in the liver. You cannot tell whether this is Chole Granuloma, TB, or neoplasia. You can see the nodules here. Here's a higher magnification of them. The nodules, they look like a lump of fat in here. That's why they call lordaceous in nature. They can be either lymphoid glycosis or Hemorrhagic disease when they come this kind of appearance. When you do histology on them, they don't have the granuloma. So it is not TB and it is not Chole Granuloma. Instead, there are cell infiltration in here, and that is either lymphoid glycosis or Hemorrhagic disease. Happen to be. Okay, continue with lesions of disease of pathology of the liver. We're talking about nodules in the liver. I mentioned these called lordaceous nodules, tumorous nodules. Again, they can be lymphoid leukosis or Hemorrhagic disease. They can also be TB or a granuloma due to other causes. Histologically, however, is going to help a little bit. You can see lymphocytic cell infiltration. In cases of Hemorrhagic disease, it will be a mixed population of large, small, and medium lymphocytes. In case of lymphoid leukosis, it is a uniform population of lymphoblasts. So it's not a granuloma, and it's going to tell us it's either lymphoid leukosis or Hemorrhagic disease by far, the majority of cases. Lymphoid leukosis is seen in mature chickens. It's seen in chickens over 16 weeks of age. it is caused by a retrovirus that is trans-ovarian transmission, vertical transmission. The reason for appearance of the disease in mature chickens is that the virus target the bursa of Fabricius. So the bursa of Fabricius is the target organ, and the virus transforms lymphocyte within a follicle in the bursa into a rapidly growing immature lymphoblast. Now, at sexual maturity, these cells will be released from the bursa. The bursa start to regress, as well as the thymus will start to regress. So the immune system, the two primary lymphoid organs in the body, the primary organs of the immune system, that is the bursa and the thymus, will start to regress after sexual maturity. So we're talking about lymphoid leukosis when there was that foci of rapidly growing lymphoblast will metastasize to other parts of the body and initiate tumorous nodules in other visceral organs, in the spleen, in the liver, and the wall of the intestine sometimes. Unlike Meniere's disease, however, Meniere's disease can occur at any age after 4 weeks. The target organ is not the bursa in this case. It's caused by herpes virus infection by inhalation of dander. That's where herpes virus of Meniere's disease matures in the feather follicle epithelium, and will be shed with dander. Inhalation of infected dander or dander carrying the herpes virus will initiate infection with Meniere's disease. And the target organ is the lung. From there, the virus disseminates to different tissues. Meniere's disease can appear in different forms. The classical Meniere's disease, I'll go over some of these. That's when the nerves, sciatic nerve, are affected. Acute Meniere's disease, sudden death, acute death in young bird around 4 or 5 weeks of age, followed in a few days by tumor formation. Transient paralysis, birds go paralyzed for a few days, then they recover, and maybe a week later they start to show tumor formation. The eye lesion, the fish eye or eye lesion of Meniere's disease, can also be seen in the skin, in the nerve, the skeletal muscles, muscular organ like proventriculus and gizzard, and this makes the differences, somehow helps in the differentiation between Meniere's disease and lymphoid leukosis. So whenever we see nodules that, in addition to the liver and spleen, if we see them on the proventriculus and the gizzard and the skeletal muscles, if we see the skin is involved, if we see the eye is involved, the nerve is involved, we're going to think of Meniere's disease rather than lymphoid leukosis. In both cases, on both lymphoid leukosis or Meniere's disease, the tumors can be either nodular, just like lumps as we saw them before, or diffuse enlargement, just diffuse enlargement of the affected organ. Sometimes we see both, a mixture of enlargement of the organ and nodular formation. I will show most of these lesions as we come talking about pathology of the various systems. Looking at liver from a game bird, you can see these grayish-white circular areas of necrosis, and the center of which kind of depressed dark red. This is pathognomonic lesion of histomoniasis, or commonly called blackhead. As we mentioned before, that the ceci are common lesions commonly confined to the ceci and liver. Also, we mentioned before that worms, Heterachus galenium of chickens or earthworm, can act as transport host. Histologically, here is a section of the liver. You can see areas of hepatic necrosis, some inflammatory cell infiltration. You can see these clear spaces in here called lacunae, and these round eosinophilic bodies. These are the parasites of Histomonas miliegridis. They are best seen when you stain them with PAS, stain periodic acid shift. They look faint with very pale with H&E, however. Histomoniasis, also called blockhead, which is a misnomer. A blockhead means cyanosis of the head tissues. It is birds with histomoniasis not always have cyanotic skin, and cyanosis, on the other hand, can be due to other diseases, other conditions. That's why blockhead is a misnomer. It should not be used. Instead, histomoniasis or pathologically enterohepatitis would be more accurate. It's caused by Histomonas miliegridis, protozoa, that can affect a variety of birds. We talked about earthworm and chicken cecal worms. Here is a liver from commercial broiler chicken, 4-week-old. You can see the liver is enlarged with these pale areas of necrosis, as well as areas of hemorrhage, foci of hemorrhage. Here is another shot, slightly higher magnification. You can see the areas of necrosis and hemorrhage. This is called inclusion body hepatitis. Inclusion body hepatitis, which is caused by adenovirus 1. Adenovirus type 1. Histologically, areas of necrosis and these large eosinophilic intranuclear inclusion bodies. You see these in advanced cases 4 or 5 days after infection. These inclusion bodies, they turn eosinophilic. Earlier than that, they look basophilic, like these ones. So early stages is basophilic inclusion bodies, which represent the virus virions itself, the virus itself. The eosinophilic ones represent the capsid and capsamere as a dying virus. You may see both viruses in the same section of the liver. I try to take several sections of each liver, and that will help me look for both the basophilic and the eosinophilic inclusion bodies. It's caused by, as I said, adenovirus type 1, usually in immune-suppressed birds. We have 2 very common immunosuppressive diseases, and that's inclusion body hepatitis, infectious bursal disease virus, and chick anemia virus. The disease, inclusion body hepatitis, the incidence went down very low after producers started vaccinating a breeder flocks against infectious bursal disease. So the disease was very common in the 60s, early 70s, until the discovery or production of IBD vaccine. We see it very rarely sometimes nowadays. I'd like to mention that it is caused by adenovirus type 1 that is related to SILO, or also to adenovirus 1, which is the cause of quail bronchitis. I'll cover that when we come to the respiratory system. There are 3 types of adenoviruses. Type 1, which is inclusion body hepatitis and quail bronchitis. Type 2, we've already talked about one of them, and that is hemorrhagic antridis in turkey, splenomegaly in chickens, and marble spleen in pheasant. Adenovirus type 3 causes egg drop syndrome, or egg drop syndrome 76. I'll show you a picture of that later on. Looking at liver from chickens with areas of necrosis, hemorrhage. There is a large infarct piece of the liver. These are liver infarcts. Excuse me. In turkeys, by far the most common of these infarcts is erysipelas. Okay, and in chickens they can be due to erysipelas, yes, but we don't put erysipelas in. This was a laying chicken. We don't put erysipelas #1 in there because it doesn't come very often in laying birds, in laying chickens. Okay. Nevertheless, this happened to be erysipelas. Was a case that I had 2 years ago of erysipelas in laying chickens, large infarct. Histologically, you can see the areas of necrosis, thrombosed blood vessels with these clusters of bacteria. There's another one. Erysipelas is most common in turkeys and to a lesser extent in chickens and other birds. Also, we see sometimes in a quail. It's caused by bacteria, erysipelotrix rosiopathy, and commonly we hear about fish pond on a farm, or pigs used to be raised on the farm, and that's where the same organism that can be transmitted from pigs to turkeys, or the organism can also live on slime, on that mucus slime of fish. So if people taking care of the fish, feeding them and then cleaning them and so forth, at the same time taking care of the birds, they can act as a way of a transmission of the organism between the two species. In addition to the liver infarcts, we will see lesions of septicemia in the body, septicemic disease. A word of caution that erysipelotrix rosiopathy can cause infection in a human is usually, I've seen several cases of these so far, is usually localized. It's called erysipeloid, okay? It is not called erysipelas in a human. Erysipelas in a human is called by strep biogenus, but it is called erysipeloid, which is called by erysipelotrix rosiopathy. As usual, a swollen finger. I've seen one case where the infection spread from the finger, went to the regional lymph node, and the lymph node became greatly enlarged. In the literature, there are a couple, 3, 4 maybe cases that I am aware of where they're describing heart lesion and describing a brain lesion where the bacteria has spread to other parts of the body. Penicillin is the drug of choice for both birds, other animals, as well as for a human. You can treat a human with penicillin whenever they get infected with this organism. It is common in butchers, common veterinarians, if without wearing gloves and without good protection. It's common in people who handle cleaning birds and processing plants. Liver infarct, just like what I showed you before, can also be caused by emboli from a remote lesion, such as abscess in the foot, like foot pad or vegetative endocarditis. In quail, as well as in other birds, can also be associated with ulcerative enteritis. And I showed you that slide before when we talked about ulcerative enteritis in quail. Here is a broiler chicken from for commercial operation. You can see fibrinous exudate covering the liver, covering the heart, peritoneum, abdominal wall. This is commonly or collectively called air sac, as a part of air sac disease in commercial poultry. Pericarditis is part of this syndrome. It is commonly caused by E. coli, usually predisposed by mycoplasma or viral respiratory infections. Sometimes management, such as if there is high levels of ammonia or dusty environment in poultry house, can also predispose for infection with E. coli. So E. coli is by far the most common organism that is isolated from these cases. I should mention that E. coli is a normal inhabitant in the upper respiratory tract of poultry. So whenever there is damage to the trachea, any irritation, it will result in septicemia with bacterial which will result in perihepatitis, pericarditis, all that air sac disease. Looking at a chicken from liver from laying bird, from laying chicken, the liver is greatly enlarged, looks like greasy, looks pale, and here we can see a big hematoma on the side of the liver. There is some hemorrhage under the capsule of the liver. This is called fatty liver hemorrhagic syndrome. It's commonly associated with in hens, usually seen in laying hens. Usually they are over fatty. They have fat accumulation in the abdominal wall. You can see so much fat under the skin here in the thigh region, the neck region, around the heart. So these birds are overweight. They have so much fat accumulation, which happens to also accumulate in the liver. The liver becomes friable and vulnerable to rupture like this. Sometimes we don't see the hematoma sitting outside, rather we see a clotted blood sitting under the capsule of the liver, like in this case here. Fatty liver hemorrhagic syndrome. The current theory about it is due to excess energy consumption. Birds are consuming too much. We see it around this time, like in the fall. Or we see it when birds were on winter diet. Okay, winter diet has too much energy in it to protect birds from cold and so forth. Then when the weather started to warm up and birds continue on that high energy diet, the bird is not utilizing that one for production or protection from cold weather. Rather than is going to transform that energy into fat, and that fat will accumulate under the skin or in the visceral organ, heart and liver. And so we see it at time of warming up of weather and due to excess energy intake. Other factors have been suggested are excessive estrogen. Fat will accumulate under the influence of estrogen. Aflatoxicosis, rapeseed product in diet have been incriminated. Why rupture of the liver is not very clear. Often in these birds, there is an egg present in the abdominal cavity. There is in the oviduct. Okay, there is an egg present in the terminal oviduct, and perhaps the bird having trouble passing that egg. There is so much fat around the oviduct. There is so much fat in the abdominal cavity. There is fat in the abdominal wall. So the tone of the oviduct, as well as the power of the abdominal wall to pass that egg, may be reduced. The bird started to push, and that's when perhaps increases the intra-abdominal pressure and predisposes for rupture of the liver. This is circumstantial evidence. That's what is present and nobody has measured the intra-abdominal pressure in laying chicken, or not that I'm aware of anyway. I'm going to move from the liver now to the respiratory system. It's an interesting system because, and more or less, the bird will respond in more or less similar way, regardless of what you insult them with. I'm going to talk first about swollen facial sinuses, and again, this can be caused by a variety of organisms, whether it's a bacteria, whether it's a mycoplasma, bacteria, parasites, or viruses, can cause swollen sinuses. Here are more viruses that can also cause swollen sinuses. Here is fall color bacteria, pox, and laryngeal pox. When it comes, the wet form comes in the sinus, can also cause a swollen sinus. Mild form of laryngeal virus infection can also cause a swollen sinus. So regardless of the agent, it seems the sinuses will be swollen in so many respiratory diseases. Histologically, again, is not very characteristic lesion, histologic. First lesion, you're going to see like loss of cilia, disciliation, there will be necrosis and desquamation of the epithelium of the sinus, and that's associated with inflammatory cells, infiltration with edema, and that's in early stages. Later on, there'll be hyperplasia and hypertrophy of the sinus epithelium. There is nothing characteristic about that, whether it's Newcastle, influenza, or mycoplasma. More or less will gives very similar lesion. That's going to help in certain histopath will help, however, in certain diseases which are characterized by inclusion bodies or that kind of thing, laryngotracheal pox. Otherwise, it will be tough to, will be maybe even misleading to use histopath alone for diagnosis. You have other complementary, you need to use other complementary tests. I'm going to go over some of these in a little bit more detail. Here is a backyard chicken. You can see swollen sinuses in here. It looks like colored, looks like coryza, looks like a lot of things. You open this sinus and it's filled with caseous exudate. Look at the histopath though. The histopath, you can see here is the nasal septa in here. You can see the mucous gland. There is squamous metaplasia and keratinization. So that is vitamin A deficiency. Look how the wide range of causes of a swollen sinus, from nutritional to viral and bacterial infections. We talked about vitamin A deficiency earlier when we talked about the mouth and the oral cavity, esophagus, crop. Vitamin A can be seen in any tissue wherever there is simple epithelium. Okay, so we're going to see it in the sinuses. You're going to see it. That's, as a matter of fact, in the sinuses is the earliest lesion of vitamin A deficiency before it appears in the mouth or in the esophagus. You're going to, if you do sectioning of the nasal tissue, you will see earliest microscopic evidence of vitamin A deficiency. And here in the sinuses, it may predispose for other bacterial infection, and that may contribute, in addition to the mucus, that's on keratin, secondary bacterial infection secondary bacteria will find that's good media for multiplication. So the swollen sinus may also be due to that bacteria. In addition to the sinuses, we mentioned the esophagus, mouth, crop. We'll see it in the renal tubules, in the lining epithelium of bursa fabricius. You're going to see it in the bone as well. Vitamin A affects multiple systems. Here is a turkey with a swollen sinus. Again, it could be a variety of agents causing this. Typically, is due to Mycoplasma septicum, and that's called infectious sinusitis. You cut the sinus, and you can see thick exudate filling the sinus. This is infectious sinusitis caused by Mycoplasma septicum, which is transmitted through the eggs. Mainly, the organism is fragile, cannot sit outside for long. For this reason, the horizontal transmission perhaps is of secondary importance. In addition to the sinuses, air sacs may become infected. There will be cases exudate in the air sacs, and that is that's really major cause of condemnation of turkeys due to infectious sinusitis at a processing plant. It is chicken with a swollen sinus. Again, it could be coryza, it could be cholera, it can be a variety of things, maybe like. So without complementary other tests, it will be really hard. Without additional history or other lesion signs, it will be really tough to tell from the picture on a slide too. This happened to be foul cholera. You open it, there'll be caseous material just like the previous one. However, you need to culture. And that's where we culture from, isolating Pasteurella maltosida, which is the causative agent of foul cholera in chickens and turkeys, by far most commonly. 2 species affected by this. Seen other species of birds too. It's characterized by acute septicemia at first, hemorrhage and necrosis all over the body, and then localization. Okay. Some strains of Pasteurella are mild to start with, and they may initiate a chronic form of fowl cholera from the beginning without going through the acute phase. The chronic fowl cholera is characterized by localized infection. Just cases, exudate is localized in the wattles and the joints, sternal bursa, sinuses and lungs, middle ear, and the ovaries, a cranial bone, meninges causing torticollis. We'll see some of these as we go along. Here is another chicken with a swollen sinus. Again, could be anything. Do culture of them. It turned out to be Haemophilus Galinarum. So that's infectious coryza. One word about the disease is that differs from cholera, where it's not as chronic, it's not only individual bursts. Coryza is more acute disease that spread very quickly. So that gives you a hint from the history. It is possibly coryza based on the clinical presentation of the cases. It's unlike cholera, okay, where it's a chronic and slowly spreading and so forth, the chronic form of it. So culture is going to help. From the slide, however, it's really hard to tell which is which. Believe it or not, this is a mild case of laryngotracheitis. I had this case 3 or 4 years ago. Birds were vaccinated for mycoplasma or mycoplasmic recepticum. These are layers. We're also vaccinated for laryngotracheitis in the pullet in the growing house. And then when they moved to the laying house, 3 or 4 days, they started shedding the virus, started shedding. Live mycoplasma was vaccinated with live LT virus. They started shedding the virus mycoplasma. It seems there was interaction between the two. You can see runny eyes, watery eyes, conjunctivitis, swollen facial signs, slightly swollen face. Put them on antibiotic, took care of the mycoplasma. So mild laryngotracheitis can cause lesions like this. Mycoplasma maybe interact with vaccine of herpes, cause similar lesion to that. Watery eyes and conjunctivitis in mild cases. In severe cases of laryngotracheitis, we'll see it in a few minutes, will be necrotic hemorrhagic tracheitis. Here is a miscellaneous case. We can see is a turkey with kind of swollen face, swollen head and neck. Here is another shot of that one. This should not, I mean, the slide may be confused with inflammatory process and all that, but in real life, you touch them, it's all filled with air. This is called wind puff or subcutaneous emphysema, or what it is escape of air from the respiratory system, from the air sacs into the subcutaneous tissue. May follow some injury, penetrating wound to the air sacs, wherein the skin healed, but the air sacs and the muscles remained open, escaping air. Also, the air sacs in birds penetrate the bones. That's why they call some of the bones, I call them pneumatic bones, the wing bones, some of the vertebrae, the skull. Air sacs continue into these bones. And if there is a problem, a defect in air sacs penetrating these bones, that's where you're going to see some escape of air. This individual bird problem has no significance at all. Just want you to be aware of that. Going down the respiratory tract, talking about tracheitis. Again, tracheitis can be caused by a variety of agents, viral, mycoplasma, bacterial, parasites, even management. I mean, high ammonia and high dust will cause more or less similar, particularly similar histologic lesions. There will be deciliation, necrosis, and desquamation of tracheal epithelium with edema and inflammatory cells in early stages. There will be hyperplasia and hypertrophy of tracheal epithelium in later stages. So histologically, you cannot tell whether it's ammonia or dust or whether it's infectious bronchitis, more or less, okay? With the exception of diseases like laryngotracheitis, like pox, like adenovirus, coelobronchitis, like TB, parasitic tracheitis, with the exception of these ones where there is some characteristic histopath findings. I'm going to go over some of these. Here is a young chick, and you can see that cages of plugs are present in the trachea as well as in the bronchi, the bifurcation of the bronchi. This is infectious bronchitis in young chicks. Histologic, however, more commonly we see just reddening and of the tracheal mucosa and increased mucus in the trachea. We don't see that one very often, like bad like that. Here is histologically, there is loss of cilia in here. There is edema, all this empty spaces you can see in here, inflammatory cell infiltration, some necrosis and desquamation of cells. So you can, this is acute tracheitis, okay? And here we go, chronic tracheitis, hyperplasia, hypertrophy of the tracheal epithelium. It doesn't tell you beyond that. There is nothing characteristic that tells you something else. Infectious bronchitis caused by coronavirus. As we saw, there were cases plugs in the trachea. Some strains of infectious bronchitis virus will hit the kidneys, will cause damage in the kidneys, nephritis syndrome. Some of them also cause damage to the oviduct, and we will see these lesions as I go along. So there are some strains not only hit the trachea, but the oviduct and particularly the uterus and the kidneys. Looking at trachea from chicken, and you can see all this clotted blood in the lumen of the trachea, reddening of the tracheal lining. If this in chickens, it can be like from the picture now. It could be laryngotracheitis, could be Newcastle, it could be influenza. You cannot tell without further history, without some histopath to tell if it is LT. Here is milder strains of laryngotracheitis, when we can see again reddening of the tracheal epithelium, cases of plugs in here and reddening. Okay, histologically, we're going to see that the best area for looking for these inclusion bodies will be some desquamated cells that what is called syncytia, where the cells get together forming clump like this one. And with these intranuclear inclusion body, I found that the best site to detect an inclusion bodies with LT, and that's what it was, laryngotracheitis. Here is a quail, and what we see in here is the trachea filled with that frothy or caseous exudate in the trachea. Now, when we talk about a quail, we don't talk about infectious bronchitis of coronavirus. Coronavirus infects only chickens of infectious bronchitis. Quail bronchitis in a quail is caused by adenovirus 1. Remember, that is related to adenovirus 1 of inclusion body hepatitis. We talked about it before. In addition to damage to the trachea, it will also cause damage in other tissues, liver, spleen, bursa fabricius. Inclusion bodies will be found histologically in various tissues. For some reason, I put the liver in here, and you can see areas of vacuolation, necrosis, and so forth, and these intranuclear inclusion bodies. That's adenovirus 1 of quail bronchitis, affects very young birds, younger than 4 weeks, causes very high mortality. Mortality easily, in the cases I have seen, can reach 80%, 85%. Most often, when it reaches that high, 90%, so the owner himself will kill the rest 10%. So it's almost 100%. It can reach 100% on its own. The disease can cause that high mortality anyway. Excessive mucus in the trachea, air sacs, they'll be hepatic and splenic necrosis, as I showed you. Okay, here is a trachea from a pheasant, either pheasant or a quail, I forgot which. I saw this about 6 or 7 years ago. From outside, you can see a kind of dark, clotted blood in the trachea. Now, this is a quail. It is not a chicken. If it was chicken, I would think of laryngotracheitis and Newcastle or influenza, something like that. But when you talk about a quail, number one on the list, it should be parasitic tracheitis or gape. When you open the trachea, in addition to the blood, and so you can see these worms. So this is what is called syngamous trachea or gape worm. They cause gape in live birth. Here is the cross section of the trachea, severe necrosis, extensive necrosis of tracheal epithelium, and you can see cross section of the parasites. Happen to be a female here. You can see some eggs. There is another female in here, but there is a male sitting next to her. Usually the male and female are always in copulation in the trachea. There are different names for this. It's also called red worm, or because they live on the blood, or forked worm because the male is always in copulation, in contact with the female. He's slightly shorter, and the copulatory organ, the bursa, copulatory bursa, is in the first third of the female. So when he attacks, it makes just like a letter Y or a fork. That's why it's called forked worm. Causes gape, which means difficult respiration. Going down the trachea, we're going to talk about air saculitis pneumonia. We don't see very much pneumonia in birth, rather than we see more air saculitis. Just like in beef cattle, we see bronchopneumonia very common. Why? Because the organism settled to the cranioventral part of the lungs. In birds, the air sacs continues with the lungs. So perhaps that's why we see air saculitis rather than pneumonia. And air saculitis pneumonia can be caused by a variety of agents. By far, most of them are due to bacteria. May be predisposed by upper respiratory tract infection, viral infection, or mycoplasma infection, or vaccine against respiratory viral diseases. Can also be caused by aspergillosis, parasitis, which we just covered, parasitic pneumonia, tracheitis. It is an air sac disease. We talked about that earlier when we talked about perihepatitis, pericarditis peritonitis, commonly caused by E. coli. The early lesion of this is foamy air sacs. This foamy exudate looks like as if you wash the gut with soap, which is the case in this slide. Actually, it's just foamy exudate covering the abdominal air sacs and peritoneum here. Later, there will be septicemia and causing thick fibrinous exudate on the air sacs as well as on the visceral organ. In poultry, commercial poultry is commonly due to E. coli, predisposed often by these infections or vaccinations or management factors of ammonia or dust. E. coli, I mentioned that earlier, is a normal inhabitant of upper respiratory tract. So in pet birds, if you see pericarditis, perihepatitis, you should think of chlamydiosis rather than E. coli, because there is a potential it is being chlamydiosis. So we should think of that, number one. Pet birds don't carry E. coli, not like chickens. They eat seed and they don't have much E. coli source from the feed, not like chickens. Now, Mycoplasma gallisepticum alone will cause chronic disease, chronic infection in birds, characterized by mucopurulent exudate on the air sac. And that's why it's called chronic respiratory disease, CRD, commonly known CRD, okay? When that CRD, when that mycoplasma is complicated by E. coli infection, it's going to go beyond the air sac disease. It's not only chronic respiratory, it's not only air sac disease, it's not only chronic respiratory disease. It's going to be pericarditis and perihepatitis, peritonitis, and that's why it's called complicated CRD. It's complicated by E. coli. It's important from a treatment point of view. Here is lungs from a turkey. You can see caseous nodules, plaque in the lungs. Here is a chicken. You can see these caseous nodules or plaques in on the air sacs in here, disseminated. This is on the kidneys. Is on the kidney. They look like circular. They have elevated edges. They look like as if they are concave on their exposed surface. Caseous plaques most commonly are due to aspergillosis. Histologically, you'll see granuloma with these hyphae. Okay, they are septate hyphae. They branch at about 30 to 45 degrees. They are even in their width, so they don't look like. You should differentiate that from phycomycosis, which they are not septate. They don't branch like at 30 to 45 degrees. They are not even in their width. These ones are even in their width. The same width of the phycomycosis goes narrow, wide, narrow. It's not even in there. Okay, so this is with PAS, and this is Aspergillus fumigatus, Aspergillus species. Here is with GMS, Gamma methanamine silver stain. It looks like black hyphae, the same characteristic as in PAS. It's commonly, Aspergillus commonly caused by Aspergillus fumigatus, occasionally by Flavus or Niger. Penguins are very susceptible. It can affect a variety of birds. Captive birds are very susceptible. When it comes in young bird, usually the source of it is contaminated air system of the incubator or of the hatcher. That's why it's called brooder pneumonia, because the clinical signs will appear while the bird is still under the brooder during the first few days of life. Excuse me. Aspergillosis can also be seen in older birds, and the litter, moldy litter, decaying vegetable matter are usually the source of the fungus. Here are nodules in a chicken in lungs of chicken. From the slide, it could be a variety of things, including, I would say, number one, aspergillosis. Okay, it can be neoplasms, could be Chole Granuloma, or it could be TB. But TB will be very rare in the lungs, so I would not put it on the top of the list, put it at the bottom of the list. And nevertheless, I'm just trying to show you how TB looks like in the lung, and that's what it is. It is a higher magnification. These nodules that may be hard to tell from a slide from aspergillosis, for example. Histologically, it's typical granuloma, which are acid-fast organism positive, acid-fast positive, so it is mycobacteriosis. Isolate the organism quite often is Mycobacterium avium. As we don't see respiratory TB very much. It's usually digestive, so the intestine, the liver, the bone, spleen, bone marrow are commonly affected. Very rare is it in the trachea or in the lungs. Excuse me. We're looking at a lung from a turkey, dark red, consolidated lung, covered with fibrinopurulent exudate. This is called cholera pneumonia. So we have pneumonia. This one's seen mostly in turkeys due to Pasteurella maltacida. Occasionally we see it in chickens, not as much. So pneumonia, we don't see very much pneumonia. Here is one condition, which is Pasteurella or cholera. Here is another one. It's also pneumonic lungs, dark red, consolidated. But there is no fibrinous exudate on it. This happened to be erysipelas. So it's very similar to pneumonia, except it does not have the fibrinous exudate. It doesn't have pleura affected. Fowl cholera, As we said before, it's caused by Bacillus multocida, pneumonic lungs with yellow exit on the surface. We see it mostly in chickens more than in turkeys more than in chickens. Here's a broiler chicken, 4 or 5 weeks, 3 weeks old, 6 weeks. Common condition these ages, you can see great distension of the abdomen, and this is called ascites. By far, the most common cause of ascites in broiler chickens is cardiomyopathy, right ventricular failure. Let's say this is a normal size heart. Again, by comparison, you can see this heart is greatly distended on its right side. When you cut the cross section, here is a normal heart. Here is the left ventricle. From here to here is very thick. It's thick and is meant to be for pumping of blood. On the other hand, the right ventricle is very thin wall here and is closely adherent to the wall, to the outer wall of the ventricle, of the left ventricle. When you look at it here, you can see the wall is slightly thickened and the lumen, that is the right ventricle, is greatly distended. That's what we refer to by right ventricular failure. Eventually, both the right and left ventricles will be affected. Here's a normal one. You do cross section and you can see the great dilation of the left ventricle as well as the right ventricle. Most people die before they reach this stage. I pulled the right wall, the wall of the right ventricle to the side just to show you how maximum the size in a normal bird can be versus this one, maybe 4 or 5 times the normal size. Excuse me. Ascites on right ventricular failure, as common in the broiler chickens, is a multifactorial disease. Okay, I lost the. Ascites on right ventricular failure is a multifactorial disease with an underlying reason being these birds are growing very fast, and this is coupled with limited pulmonary lungs capacity with high demand for oxygen. It's because the metabolic rate is too high because of fast growth. So eventually there will be pulmonary hypertension. This is I'm backing up of blood in the lungs. That will cause right ventricular dilation. The right ventricle is not made, is not built to pump against the pressure. That is why there will be backup of blood into the right ventricle, which leads to right ventricular dilation, hypertrophy, and eventually there will be backup of blood in the left heart side and left side of the body, meaning in the liver, in the intestine, abdominal, in the viscera, and fluid started to escape from the blood vessels in the abdomen, causing this condition of ascites. Looking at a heart, this is a broiler chicken, 5-week-old, very good body condition, died acutely. You can see the fat around the proventriculus. Here is the gizzard. You open that bird and you can see the crop is filled with food. Again, it's good body condition. This is called acute death syndrome or flip over. Birds that died with this disease usually have 2 hearts. No, I'm just, okay. Birds usually have slightly elongated heart, as I'm showing here, comparison to the normal. That would make it easy to diagnose having two hearts. Here is a higher magnification. You can see the heart is slightly elongated than normal, which may indicate that the heart stops in systole. Birds in good body condition, full digestive tract with food, fatty bird. Acute death syndrome or flip over, commonly seen. Dead birds are laying on their back, dead on their back. Okay, the lungs are congested, fluid is present there. Some people think this is artifact. It's not true. If you check these birds, if you pick them up immediately after death, you may not see these congestion and edema of the lungs. So, acute death syndrome seen in broiler chickens, sudden death, dead birds on their backs. Exact cause, exact pathogenesis is not well known, and several theories has been suggested. Here is a heart from a turkey. Here's a normal heart. You can see the heart is greatly enlarged, and this is due to hypertrophy, commonly called round heart disease. Can be seen in chickens and in turkeys. In chickens, usually seen in older birds, and due to hypertrophy, the heart is hypertrophied, and the apex of it is dimpled. Seen in young turkeys, however, and less than 4 weeks of age. And you will see ventricular dilation, pale livers, and congested lungs. Maybe ascites is present there. The exact cause is not known. However, the lesions are indistinguishable from vitamin E, selenium deficiency. Similar lesion being described in birds, in experimental birds, furazolidine toxicosis, sodium toxicosis, rapeseed, and toxic fat in the feed. Here is a heart from commercial broiler chickens. You can see fibrinous pericarditis, fibrinous perihepatitis, similar to what we have described before under air sac disease. Excuse me. So pericarditis, fibrinous pericarditis can be caused by generalized bacterial infections. It's commonly due to E. coli in commercial poultry, similar to what we described under air sac disease. I'm going to stop here. Okay, now we're going to continue into pathology of the skeletal system. First condition I'm going to talk about is tibial dyschondroplasia. It happened to be in the tibia, that's why. Otherwise I would call it dyschondroplasia, because it can be seen in other bones as well. Here's a normal tibia. This is secondary center of ossification. Obviously this is immature bird, because you can see the growth plate here. That's a gray zone, and this is zone of ossification, the white one. What you see in here is a large mass of cartilage occupying almost the entire head of the tibia. This is called dyschondroplasia. Sometimes you don't see it as extensive as that one. It may occupy only a half of the head or so. There's a normal one here, so it's partial or complete occlusion of the head of the tibia with this abnormal mass of cartilage. It has no significance if it is mild. However, if it is severe, the head of the bone will bend like this. It's simply because the cartilage cannot bear weight as the bone does, so eventually it will give, and so it will bend like this, and it may result in a fracture. In the processing plant, they'll see a large head of the tibia like this, which can be confused with arthritis, synovitis, so they will cut the bone, they will cut the joint, may open the bone, and that will result in some downgrading because the bone being cut. Here is the same lesion in the metatarsus. Here's a normal one. That's why I don't prefer to call it tibial dyschondroplasia, because it comes in other bones as well. So this dyschondroplasia will do. As seen in fast-growing chickens and turkeys, the exact pathogenesis is not known. There are various theories have been suggested. The basic lesion is that the proliferating cartilage failed to ossify, so they will continue to grow, and there you go, we have a big cartilage instead of being ossified into bone. Defective maturation of the cartilage or deficiency of chondroclast to get rid of that cartilage, become failure to mature, so it's not going to be transferred into zone of hypertrophy from pre-hypertrophy. Maybe there is a trauma to the blood vessels, that's why it is not maturing. There are some toxic products that have been associated with the condition, at least experimentally. There is this tetramethylthiram disulfide, which is antifungal agent. Oh, they were able to reproduce the disease experimentally, even in a slow-growing birds. This dyschondroplasia is usually seen in fast-growing birds, but with this product, they were reproduced even in laying type birds. Genetics: fast-growing birds, cation, anion, acid-base balance of in the ration, mycotoxicosis, calcium, phosphorus, all have been in one way or another being incriminated in the pathogenesis of this condition. I should speed up. I have 1 more hour to go, or even less, and I want to show you as much as I can. These are turkeys. They are unable to walk, young birds. Here are ducks, the same problem. They are unable to stand. In this case, they are crooked. The legs are weak, and this one in young ducks. On necropsy, you can see the keel bone is deviated like this, sigmoid like in here, curved. The ribs are kind of crooked, and their articulation with the spinal cord is enlarged, as in here. Here is more advanced of that one. You can see how the thorax is kind of crowded with these crooked ribs and enlarged articulation of the rib with the vertebral column. What is happening is that the growth plate in here continue to grow. There is no ossification. This is due to this is rickets, okay? And it's caused by calcium deficiency, phosphorus deficiency, vitamin D3 deficiency, or imbalance between calcium and phosphorus. Too much calcium, lack of phosphorus, something like that. So what's going to happen is that the growth plate of the bone, which happens to be here in the ribs, is going to continue to grow. They'll produce cartilage, and it's not going to ossify. And the cartilage will become large, and that's what you're looking at here. These bones, the leg bones, when you try to bend them, they'll bend just like a green stick. That's I like that analogy. It's rickets seen in young birds, and when you try, the bones are soft when you bend them, just like a green stick. Sometimes these ingredients are present in the diet, but the bird is not utilizing them because there is enteritis or something interfering with absorption of these ingredients, such as toxicosis here. Sometimes birds with rickets may show respiratory or nervous manifestation, and you can understand that looking at that thorax, how crowded it is. So it's going to interfere with proper respiration, exchange of air, nervous manifestation, perhaps because of these soft bones compress the central nervous system, the brain, the spinal cord, causing some nervous manifestation. It should not be confused that way, however. Here is a mature bird, it's a laying hen. You can see that the articulation between the sternal and the vertebral portions of the ribs, which are here, they call the costocoronal junctions, they are swollen, enlarged, and that is why it's called the rosary character. Okay, the ribs in birds have 2 parts, one part attaching to the vertebrae, the other part attached to the sternum, and they articulate in the middle. Okay, and that's what's called the costochondral junction here. Again, it's cartilage. There is growth plate in there, and that's why they look enlarged like here. There is a fracture in here. It looks like a greenish. There is some clotted blood and all this. This is a mature bird. We call it osteoporosis instead of rickets. It's called osteoporosis. It's the same thing. It can be caused by calcium, phosphorus, D3 deficiency, or imbalance between calcium, phosphorus. But because in mature bird, it is called osteoporosis. In addition to the deficiency, possibly the management, being the birds being raised in cages, they don't have perhaps enough exercise, has been incriminated that way. Also, these birds are high producing birds, so genetics may be another factor. They have high demand for calcium to build that eggshell, and probably what is stored in the bone is not enough. Birds take calcium from the diet, at the same time compensate from their bone to build that eggshell. If there is no enough in the bone, the bone gonna go porotic, is gonna become very thin, and eventually will break. For this reason, bones from adult birds, with osteoporosis, they break just like a dry stick. Okay, so rickets will bend just like a greenish stick. Osteoporosis, they'll break like a dry stick. Here is emus. We get emus in Mississippi too. As if we don't know, we need more leg problems. These birds are prone to this crooked legs or crooked necks, as we see it here. Valgus or varus deformation is common in rapidly growing poultry, other birds. The deformity seems to be in the cortical bone, and that's when the bone becomes twisted in its middle. The tendon is not slipped, though. The tendon stays, gastrocnemius tendon stays where it is. Faster growth, these birds are growing very fast, so there is so much weight on these bones. Maybe restricted exercise, there's so many birds in the same area. Maybe there is marginal deficiency of so many ingredients have been suggested, several vitamins and minerals and so forth. And Mycoplasma meleagritis infection, especially in turkeys, has been associated with this problem too. And the theory is that Mycoplasma meleagritis will deplete the bird of these essential nutrients and make them so marginal or deficient, and predispose the bird for crooked legs. Here's a chicken with a swollen hog joint. The tendons above the hog joints are also swollen. Here's a normal one. This is commonly called arthritis, tendinitis. When you cut through the tendon, you can see and joint, you can see all this caseous material between the tendon sheaths, the membrane, fluid, the kind of turbulent fluid in the joint. So this is arthritis, tendinitis, commonly associated with osteomyelitis, as here. There is a tibia, and you can see it's immature bird. I'm going to consider that immature bird because I'm going to show you mature bird with a different kind of lesion. There's also osteomyelitis, but due to different cause. So here is immature bird. You can see the growth plate, and you can see this yellow-white area of necrosis in the growth plate region. This is called osteomyelitis. In young birds, she's in a turkey, that was chicken. This is a turkey, and basically the same lesion, area of necrosis, in the growth plate region. There is some dyschondroplasia in here as well. Here are the femurs. Here's what is supposed when you disarticulate the hip joint. The head of the femur should come out like this. However, with cases of osteomyelitis, we can see various degree of necrosis. You can see here that the articular cartilage separated from the head of the femur. There is some necrosis of the femoral head here, more necrosis in this case, and that's what has been described by some people as femoral head necrosis, being associated with osteomyelitis. However, it can be due to other causes. Here's how it looks like histologically, osteomyelitis histologically. It is the growth plate area. You can see massive necrosis of the cartilage. Inflammatory cell infiltration. You can see these clusters of bacteria within the remains of the blood vessels, inflammatory cells, just wide spread areas of necrosis of the cartilage and bone. Here is a chronic osteomyelitis characterized by this typical granuloma, localized infection. Here is what is called a green liver from a turkey with this green discoloration. And basically what it is bile stasis. So bile get it trapped in liver tissue, and currently the FSIS, USDA are using green liver as an indirect indicator for possible presence of osteomyelitis in turkeys. So whenever they see birds with turkeys with a green liver online in the processing plant, they pull that turkey, cut the joints and bones, and verify whether there is osteomyelitis or not. If there is, they tank parts of the whole bird. Depends on how spread the lesion is. They have a kind of special tank cut system. If there is no osteomyelitis, that bird will be downgraded. So the turkey industry is losing so much because of downgrading of turkeys, and because of the association with the green liver, which is a kind of poor association. It's not very good association. Arthritis, osteomyelitis in young birds, in young poultry, is commonly due to Staph aureus, Staphylococcus infection, and E. coli. There is usually septicemia and then localization in the joints and bones. It is a young bird, okay? As you can see, the growth plate, it is a zone of ossification. Now, this one is a mature bird. There is no growth plate, okay? Let me do it one more time. It is a young bird, and you can see the growth plate here. Okay, there are 3 zones in here: zone of proliferation, pre-hypertrophy, hypertrophy, and then the zone of ossification. So it's a growing bird. The growth plate will close in chickens about 20 weeks or so, in turkeys around 24 weeks. So you can see this is a mature bird because it doesn't have a growth plate. They have these yellow areas of necrosis. There's also osteomyelitis. Here is a higher magnification of that. This is also osteomyelitis, but number 1 diagnosis will be TB. Why? The lesion is not restricted to the growth plate as we saw it in young birds. Here is widespread anywhere in the growth plate. This is usually a mature bird. Acid-fast positive. You can take a sample of this, just crush it between 2 slides. Acid-fast positive STB, made the diagnosis. Or you do histopath. The lesion will be widespread in other tissues as well, liver, spleen, and so forth. Mature birds, usually they are lame, prolonged illness, and death of individual birds, periodic death, granuloma in various organs. Here is a footpad, a swollen footpad. There is no cuts or wounds and so forth, so obviously the infection has come from septicemia and then localized in here. This is infectious cyanovirus. It can be seen in a footpad or in the hock joint. Infectious or external bursa sometimes. Infectious cyanovirus seen in chicken turkeys by Mycoplasma synoviae, MS. Swollen joints is the main lesion. Here is another swollen joint from a chicken. You open that one, see some a kind of turbid, yellowish, reddish, brown, reddish exudate in there. Culture this one turned out to be Pasteurella multacida, the chronic form of fowl cholera. Looking at a footpad here, but you can see some wounds in here. There is scabs, old injury in here. This is what is commonly referred to as bumblefoot. Okay, bumblefoot. Here's when you carry to see all that caseated material and so forth. Bumblefoot is an individual bird problem. You see it in heavy breeds and backyard flock mostly, occasional commercial, just individual birds. The infection is through cuts, through wounds on the skin of the foot, either on dorsal or the ventral. These are heavy birds, and often with contact with litter or with their perches, when they perches on the wood and so forth, causes some injury to the skin, which permits bacterial entry and causing local inflammation in there. Variety of bacteria being isolated, E. coli, Staph, Proteus, Strep, whatever is available in the environment, have opportunity to go in and participate in the dilemma and the infection. Looking at a foot from a chicken, a kind of deformed toes, swollen joints. This is a classic picture of articular gout. Articular gout. And two gouts in bird, articular and visceral. I got this case last week. Unfortunately, the bird was slightly otolite, but when I disarticulated the hip joint, look what's in there, all that chalky white material covering the articular cartilage of the femur. This is articular gout. This was a chicken too. Articular gout is a sporadic individual problem, but believe it or not, in this case I just showed you, it was an outbreak. It was a mass. A good number of the birds were affected. That was calcium problem, miscalculation, or it was a mistake during in the feed mill that caused that problem. Too much calcium in the feed. Articular gout can be due to high protein diet. It used to be called the king disease. King's disease, where they eat too much meat, they don't walk around. That's where too much uric acid production. That's what the history says. Articular gout can also be caused by defect in tubular secretion of uric acid. Anytime there is a problem in the kidneys, there will be buildup of uric acid in the blood that will precipitate in the joints. And it may accompany visceral gout, that is secondary to kidney damage. We'll cover that when we come to the urinary system. Okay, what we're looking at here is broiler chicken. You can see that the toes are curved laterally to the outside. This is called crooked toes. A crooked toes. We see it in commercial operations. Good number of the birds may have this problem. Used to be more when we raise the birds on wire or there is a wet litter. We don't see it as much. The exact pathogenesis is not clear, but I said higher incidence used to be seen when the birds raised on wire or wet litter. Shortening of the flexor tendon has been suggested as a possible cause. Shortening of the tendon, and I'm going to pull the toes to the side. It should not be confused with riboflavin deficiency, where there is ventral curving of the toes rather than to the lateral. We'll show that later. Has no significance. Here is a broiler chicken, paralyzed, unable to walk and so forth. Got the vertebrae here. Here is T6. Here is the anterior part of T6, where it is compressing the spinal cord. Here is the other half. Here is T6, and here is the anterior end compressing the spinal cord. This is called kinky back or spondylolisthesis, When you open the bird, you can see the region of T6 is enlarged. Seen in the broiler chickens, exact pathogenesis not clear, maybe fast growth and heavy weight, the weight of the bird. So see, T6 is the only synovial joint. All the other ones are fused, and so probably that creates a pressure on this joint. The weight of the bird pull down, and that's probably a weak point. That's what is suggested. It's not. Here is a turkey, excuse me, and here is the T6 region. You can see these. The ribs are very close. It is very wide. The T6 are kind of pulled to the side, so it's lateral deviation instead of ventral. It's lateral. This is called the scoliosis. Here is another view of that scoliosis. Again, pathogenesis is not understood, and fast growth and heavy weight may be responsible for that. It's individual birth problem. Is not a major economic significant one. Here is a chicken from Broiler Chicken. Here's a leg. You can see some green discoloration of the skin above the hog joint. When you cut the skin, you can see that was associated with blood under the skin between the leg tendons, and that blood associated with rupture of the leg tendon. This is gastrocnemius tendon. That's what it's called, ruptured tendon, ruptured leg tendons. You see it in some books. Literally, it's called Cyanovirus. I don't know if that is true or not. Probably is not very accurate description. Ruptured tendon probably is a more accurate because Cyanovirus has been incriminated, but I don't think it's been approved. Okay, yes, the virus, if it attacks the tendon, will cause fibrosis, weakening of the tendon, and eventually rupture. I don't know how well is that documented, however. I see it quite often, not quite often, I see sometimes in very fast growing birds, especially certain breed. I've seen it where both male and female of the same breed that are heavy, fast growing birds. That breed, particular breed, is very fast growing. And if you put male and female of the same, that fast growing breed, I see them, they are more susceptible to that rupture of the tendon. So the bird is growing very fast, and the tendon is weak, cannot handle all that weight and pressure and all that, and may rupture that way. This is just a suspected how it goes. Here are feet from Turkey. You can see that the toes are clipped. Here is another one. You can see the middle two toes are clipped. And this is called toe clipping. I put it here so that just to not to confuse it with frostbite or ergot. Okay. Usually these are baby chicks, or and they use it in chicken broiler breeders too, as well as in turkeys. They all in the hatchery, they clip these, and the reason is that these are breeders. They are very heavy breeders, and in order to avoid scratching, slashing of the back of the hand, they cut the toes. They clip the toes, toenails, and a little bit of the toe of these two middle toes. Whoops. So differentiated from other conditions such as ergot or frostbite, history. Oh yeah, we clip these ones. Time of the year is in summer versus winter, maybe. Appearance of the lesion. Ergot, you will see it in other parts of the body as well. Same thing with frostbite. The comb may be affected, wattles are affected. On the lesion, all the toes are affected, rather than all of the middle two consistently. What you're looking at here is broiler chicken. You can see this, the heart or the kidneys, 3 lobes of the kidneys, 1, 2, 3, kind of poorly separated, but that's how it goes. The heart in here, you can see this white chalky material precipitate over the cirrhosis, over the pericardium. Here within the kidney tubules, Do I have another picture? No. This is called visceral gout. Called visceral gout. Okay. Histologically, here is a kidney, and you can see this kind of granuloma, giant cells, mononuclear cells, and these feather-like structures. These are the uric acid crystals. They dissolve in water when they process them for the H&E. If you want to see them, then fix the tissue instead of formalin 10%, fix it in absolute ethanol, and you may stain them with GMS, and the crystals will appear like that. These are the actual uric acid crystals. Sometimes if I have a little bit extra money, I start playing with these ones. Gout, visceral gout, can also be due to vitamin A deficiency. Whenever there is squamous metaplasia and keratinization of the renal tubules, ureters, there will be blockage of these tubes, so the sewage system will be blocked, so there will be backup of uric acid in the blood, and then it will be deposited on the serosal surfaces of the various organs, of visceral organs, sometimes in the joints as well. Commonly due to obstruction of ureters, renal damage, dehydration. Sometimes you dehydrated birds, but they don't have gout. So there could be something else going on at the same time. Here are kidneys from a goose. Renal tubules. Here, renal tubules with various stages of protozoa. You have a higher magnification here. You can see them. They are the oocysts, different stages of schizones and merozoites of Eimeria. This is called Eimeria truncata in ducks and geese. Renal Coccydiosis. Looks like just white necrotic foci on the kidneys, petechial hemorrhages on the surface of the kidney. Transmitted by ingestion and goes via the blood to the kidneys. And all stages are developed in the kidney epithelium, excreted with the uric acid, with the urine, and voided with the feces, sporulate outside, get infection by ingestion. Here are the kidneys from recently hatched chicks. You can see that the kidney tissue, there is white material within the kidney tubules as well as in the ureters. The kidneys are swollen. There was no visceral gout, This is called infectious nephritis, nephrosis. Histologically, there is massive necrosis of tubular epithelium, edema, and massive infiltration of heterophils. This is an early stage. Later on, there will be fibroblasts and plasma cells, and other cells will appear in the area. Interstitial nephritis can be caused by coronavirus. We talked about that when I mentioned about infectious bronchitis. I said some strains of infectious bronchitis, coronavirus in chickens, are nephrotropic. They'll cause damage in the kidneys. Another one is picornavirus, which is an enterovirus, causes interstitial nephritis in a similar way, mostly seen in day-old chicks. Here is a broiler chicken. You can see the kidneys. There's a male. There's a bursa fabricius. Here are the kidneys, and they are all covered with these white masses or calculi. Okay, there is some atrophy of this of the anterior lobe of this side of the kidneys. This is called renal calculi or urolith. Urolith is commonly seen in laying hens, occasionally seen in other birds, and that's what I saw. The previous case was in a broiler chicken. That's where they put 15% calcium by mistake. It's commonly thought that in laying chickens that infectious bronchitis virus, nephrotropic strain, high level of calcium in the diet, and water deprivation, such as after traveling for some distance, birds without water are predisposing factor or important in the pathogenesis of renal calculi. Here's a broiler chicken. The kidneys are kind of hypertrophy. They are large in size. The other side are missing. This is a male. You can see the testicle on this side is also a small in size. Commonly, these are referred to as renal hypoplasia. It may be anomaly. They have not been developed at all, or maybe due to functional problem, that is urolith, just like what I showed you before. That kidney function disappear, the organ failed, the function failed, that affected part undergoes atrophy. Here is a large mass arising from the kidney. Here is another one I saw a couple of years ago, where the large mass arising from the kidney, and all these white masses in here turn out to be urates. This mass is called embryonal nephroma or nephroblastoma. It varies greatly in appearance. It may be just a small nodules or a large mass like this one. Even histologically, it may appear as adenoma or adenocarcinoma, and it may be tubular or glomeruloid. It depends on what it affects. Keratin pearls like that, large number of tubular cytoma. So it varies in structure as well as in appearance. Here are the kidney lobes, again, in broiler chickens with these lumps. This turn out to be either lymphoid glycosis or Hemorrhagic disease. So you need more history, you need more lesions and elsewhere in the body, and other tests to help in the diagnosis. That was the nodular form, where you see that there are nodules on the lobes of the kidney. And this one, there is just diffuse enlargement of the kidney lobes. That is the second form. Remember I mentioned there is nodular and diffuse, or mixed between the two. So that is the diffuse form. Histologically, you can see all this immature lymphoblast. So this is lymphoid glycosis. Lymphoid glycosis and Hemorrhagic disease grossly will look the same. It could be either in the kidneys, either diffuse enlargement or tumorous nodules. Here is a turkey. You can see the kidneys in here. Is a turkey tom. You can see some blood sitting under the capsule of the kidneys. What I did in here, I cut the legs in here, here, and here in the front. I put the whole mass, all this area, I put it in formalin for 24 hours. Then I section it like this, okay, just a cross section. Look what I got. Here it is, okay, here is the vertebrae. So here is the kidney with this clotted blood sitting under the capsule of the kidney. This is called sudden death with perirenal hemorrhage. Sudden death in turkeys with perirenal hemorrhage. Toms, usually fast-growing birds. Exact pathogenesis is not clear, has so many similarities to what we describe under acute death syndrome or flip over in the pathogenesis way. It should be differentiated from aortic rupture. And aortic rupture is the clotted blood free in the abdomen. Moving to the skin, you can see brown incrustations on the skin of the thigh. This is commonly called the Scabby Hip Syndrome. There are more brown incrustations in here. Either they are just the scabs covering necrotic tissue in there, filled with bacteria and so forth. Scabby Hip Syndrome is suspected to be due to poor litter and overcrowding. So bird frequent contact with each other break the feathers and predispose the birds, that feather follicle, for infection with bacteria. Commonly E. coli and staph are isolated. Recently we started to see conditions like this one. Recently, and maybe, I don't know, I saw it maybe 3-4 years ago. where you started to see deep cuts in the skin. Deep cuts in the skin, and when you maybe scratches on the back of the skin, like in here, they look like mechanical trauma, maybe caused by the birds jumping on each other, or by the feeders, or somehow they got traumatic injuries. And when you reflect the skin, you will see this casus exudate under the skin. It's commonly called in the processing plant by infectious process. And it's been a real serious cause of condemnation in the process now. So it's economically really important. How bacteria gets to there, some people think it is due to these scratches. However, recently, here is the breast, okay, here is the keel bone, and the navel is here, used to be here, okay. And some people suggest or suspect that early infection with yolk sac infection, amphilitis, okay, that local infection will spread over time to other parts of the skin, the ventral of the abdomen, and causes this cellulitis. That's what basically is cellulitis. This is just suspected, it's not confirmed or anything. So infectious process is basically cellulitis, seen in broiler chickens. Sometimes you see scratches or deep cuts. In other cases, I don't know whether they are healed or they did not exist to start with. So you don't see these scratches all the time. But in the majority of cases, they are there if you look carefully for them. Staph and E. coli, frequently isolated. Cruising on pathology of the skin, you can see here nodules. This is a wild turkey. We see good amount of fox and wild turkeys in Mississippi. Maybe the weather helps. Lots of mosquitoes. These are wild turkeys. Mosquitoes, maybe other blood-sucking arthropods helps in transmission of the virus biting between birds. Histologically, ballooning of the epithelium with large intracytoplasmic inclusion bodies. There is hyperplasia, hypertrophy of cells. It's very characteristic pathognomonic for pox. These are called Bollinger Bodies, which I think they are the largest inclusion bodies, at least in birds. I think they are Bollinger Bodies, large intracytoplasmic inclusion. Mechanically transmitted mosquitoes may play a role. AI, artificial insemination in turkey hens. We talked about this before. Here is a broiler chicken. You can see this greenish yellow exudate over the keel bone, under the skin, or around the crop, in the thighs. This is called exudative diathesis. Exudative diathesis caused by vitamin E, selenium deficiency, is abnormal permeability of blood from the capillaries. Okay, they'll become permeable, they'll lose the blood, sit under the skin, undergoes hemolysis, heme and globin goes back, the heme goes back, globin become biliverdin, bilirubin. Biliverdin, that becomes the green in color in areas of lack of oxygen. That's how it looks like. Okay. You see the legs as from backyard chicken. They look rough, they look distorted, they look, the scales are kind of very thick, they are lifted, there is this whitish material, powder-like, underneath the scales. They are kind of deformed feet. This is characteristic appearance of a scaly leg mite infection. Histologically is basically hyperkeratosis, extensive hyperkeratosis, and you can see cross section of the parasite between the keratin layers. Similarly here, cross section of the mite. Various species of Pneumococtus has been identified in birds affected with scalenocmyelitis. It's common, more common actually in budgerigars. Occasionally we see it in backyard flock. We don't see it in commercial operations or anything. Looking at the skin from broiler chicken. The skin, this is the inner side of the skin. You can see all these areas of hemorrhage, some edema in here, some hemorrhage on the muscles, pale necrotic areas on the thigh, leg muscles. Here is how it looks like from outside. There is a kind of dark red necrotic areas of the skin. Here is the ventrum. Here is the skin of the abdomen. Looks like cooked in appearance with these dark red necrotic areas. This is called gangrenous dermatitis. See, sometimes these areas in some cases are restricted to the wing, just like in this case, okay, massive necrosis, hemorrhage of the wing. Look at this one. It's just unbelievable. This was a live bird, believe me. Live bird with this massive hemorrhage necrosis under the skin, the gas bubbles and so forth, you can't feel them. This is called blue wing or rat wing, okay. The one we see under the abdomen and all that, we used to call it gangrenous dermatitis, maybe related to this. I think they are both the same. The predisposing factor may be different. Clostridium and staph are frequently isolated from these birds. The predisposing factors are immunosuppressive diseases, such as infectious bursal disease or chick anemia virus. So seen in broiler chickens, these Clostridia isolated from them, usually immunosuppressive birds. Wing rot or blue wing, that's referred to what I described in the skin of the wing. Looking at chicken with greatly swollen wattles. This is a chronic form of fowl cholera localized in the wattles. Okay, that's the chronic form. You may see scabs sometimes, and people have confused this with a trauma. They say it's just traumatic injury and bacteria goes through. Pasteurella may not be very easy to isolate, but you have to pay really good attention to it to be able to isolate that bacteria. Otherwise, it can be missed in advanced lesion when there is other bacteria contaminating the picture. When you cut through the wattle, you can see all this caseous necrotic material. This caused by Pasteurella maltacida, the chronic form. It is a skin and muscle of broiler chicken mature. This was a laying bird. As a mature bird, you can see nodules on the inside of the feathers, as well as on the muscles. Turn out to be Mehrig's disease. Histologically, here is the feather follicle. Feather follicle epithelium is infiltrated by these mixed population of lymphocytes. It's Mehrig's disease. We don't see it like this so extensive usually in the processing plant in young birds. All what we see is that the feather follicles are enlarged, abnormally enlarged in size. Sometimes are extensively large, as if they are filled with, as if they are pustules or something within the feather follicle. That's what's commonly seen in the processing plants in the broilers. But the lesion I just showed you is not as common though. Herpes virus, Mehrig's is caused by herpes virus, and as I said, it matures in the feather follicle epithelium. It's a major cause of condemnation in some farms and some flocks. Looking at the skin from broiler chickens, I just put several pieces of skin next to each other just to show you several lesions of the same thing. These are ulcers in the skin, and this is called squamous cell carcinoma in broiler chickens. Suspected to be due to a viral etiology, but has not been confirmed to be due to that lesion. If there is a single lesion, you can trim and remove. If it is more than one lesion, you can condemn the whole bird. Here is a footpad or broiler chicken. You can see a scab on the footpad. This is commonly called pododermatitis. It can be seen at the ventrum of the footpad. Occasionally, you can see it at the back of the hog joint, and it's been associated with contact. It's basically contact dermatitis. Whenever there is wet litter, urine, and so forth, these are areas of contact with the litter, and it can cause that scab-like lesions, scabs filling ulcers. In the case of the footpad here, biotin might be involved. We have some companies that use that sell the feed for some countries for food, for human, and they add biotin to the diet. These companies seem to have lower incidence of pododermatitis than those companies that don't add. So probably biotin is involved. Biotin deficiency or marginal biotin deficiency may be involved in these cases. Looking at here is the Keel Bursa. The Keel Bursa is filled with this caseous material. This is called Keel Bursitis. It can come from outside. You can see like the skin over the Keel Bursa kind of thin and doesn't have very much feathers. And by contact, bacteria will go through to the bursa and cause all that inflammation. Or Keel Bursitis can come as from a systemic infection, then localized, as in case of Mycoplasma, pastoral staph infection. Keel Bursitis. Here is the skin of a chicken. I got it from a backyard flock. You can see this white powder-like dander or flour-like material over the skin of the head, the comb here. There is some feather loss. Histologically, there was hyperkeratosis, and you can see the mycelia in here. There is some inflammatory cell infiltration here. There is a higher magnification, mycelia, septated mycelia. This is Favus. Favus is caused by Microsporum galeni. It used to be called Trichophyton magnini. I recently learned that advances in microbiology and culture and so forth were able to differentiate Microsporum from Trichophyton. It's very rarely seen condition, usually in backyard flock. It's rarely seen, but I saw 2 cases last year. Here's the muscle. Now we're going to start with pathology of muscular diseases. What you're looking at here is this is the superficial pectoral muscle. Here is the deep pectoral muscle. Superficial, deep. And what you see is that the deep pectoral muscle is a kind of greenish, shrunken, necrotic. There's a fascia around it. This is what's called deep pectoral myopathy. Deep pectoral myopathy is seen in turkeys, is seen in heavy broiler breeders, and basically what it is infarction. What is happening is that the bird is being chased for artificial insemination or being chased, too much flapping of the wings. The deep pectoral muscle functions to lift, to move the wings. So if the bird is being chased, there will be the deep pectoral muscle will be large in size, but the fascia around it will not grow in the same speed. So as a result, the fascia started to compress the blood vessels and block the blood supply, causing infarction of that muscle, compartmental infarction. Uh, it's not infectious process or anything, okay? So we commonly, they sit in the processing plant. Sometimes it is missed. Nothing wrong with it. Unfortunately, you see it around Christmas time, Thanksgiving, where people have stuffed the turkeys and all that, waiting for 6-7 hours cooking that. Or the table is ready, and here we go. The father is cutting the breast, and whoops, it's a green liver, green muscle. Okay, there is nothing wrong with it. It's not infectious, as I say. Probably just turn around, kill that muscle, and pass it for food. Don't tell the kids about it. It's not infectious. Why should I ruin that now? I wouldn't eat it, but no. I pass it to the kids. Don't tell them. Now, what you're looking at here is breast, broiler chickens. You can see these white streaks of necrosis. I see so many cases of these, but I'm not getting a good picture of it. I don't know why. They always turn a little bit dark like this. So you can see these longitudinal streaks of necrosis. This is nutritional myopathy caused by vitamin E selenium deficiency, usually accompanied by sulfur-containing amino acid cysteine deficiency. Here is breast muscle, is the breast and leg muscle from a wild duck. And what you see in here are these rice grain-like cysts or structures in the muscle. This is called Sarcosis Galinarum. Here is a higher magnification. They look like rice, cyst-like structures within the muscle. They are not harmful. They are not very much harmful unless they start compressing the brachial nerve, and so the bird cannot fly, or the sciatic nerve, they cannot walk, and so forth. They will die by sub-freezing or cooking. Here is histologically, that's how it looks like, a big cyst, not much inflammation. However, sometimes you see extensive inflammation around him. It's caused by Sarcosis Galinarum, which is these species like ducks and other birds, mammals, including a human, can be as intermediate hosts, and they pick up the oocyst usually from stagnant water, contaminated with the oocyst from the definitive host, which is either skunk or possum. The skunk or possum will get the infection by eating the intermediate host. The duck get the macro and microgamete and start to develop the oocyst in its intestine and pass it in the feces. The ducks develop the schizones, which is in their muscles, and the skeletal muscles, sometimes in other parts of the body. People can eat this because the parasite, this parasite, if we eat it, we are also intermediate hosts who will not cause anything in a human, okay? I asked one time the student, "We're going to tell the owner about this." He said, "Well, I'm going to tell him to cook it." Okay, I'm going to start with the nervous system. What you're looking at here is a chicken from a backyard flock. And what you see here is herniation of part of the cerebrum into the venous sinuses, into the cranium. Here is another a view of that. It's part of the cerebrum herniating into the venous sinuses. This was the same bird that I showed you very early, the very first slides, with vitamin A in the esophagus, and that's vitamin A deficiency. Vitamin A is required for remodeling of the bone. And deficient birds, it seems that there is lack of remodeling of the bone, and the brain continues to grow and being compressed or herniating into the sinuses. If you look in the literature, they talk about increased cerebrospinal fluid and all that. Perhaps that's in other animal species, but not in the bird. Here is a broiler chicken, a commercial operation. It's about 2 weeks old, showing nervous manifestation, The bird characteristically sits on its rear end, flapping the wings, trying not to fall on its back. It's very characteristic posture for vitamin E encephalomalacia, vitamin E deficiency. When you open the brain, you can notice a normal one. Here is the most of the lesion is manifested in the cerebellum. Grossly, the cerebellum is greatly enlarged, and these folia, the separation, the grooves between the folias disappear simply because of the edema. Vitamin E encephalomalacia. We see it occasionally. Perhaps there is during the summer, for example, too much rancid fat, or they forgot to add the antioxidant, or forgot to add vitamin E to the diet. Some mistakes in the feed mill, something like that. It's seen in young birds, characterized by nervous manifestation. Here are young broiler chickens, 3 days old, with a history of nervous manifestation from day one. From the time they hatched, they started to show nervous manifestation. When that comes to the mind, it could be due to aspergillosis, it could be due to AE, avian encephalomyelitis. When you hold these birds, they tremble, just like a bumblebee. And that tells you an indication it's most likely avian encephalomyelitis. AE, when you do necropsy, you can see absolutely nothing. There is no gross lesion in this bird. However, histologically, you may see some perivascular cuff, as in here, neuronal degeneration, and gliosis. Okay, and in the brain, you may see some lesion in the spinal cord as well. Avian encephalomyelitis caused by picornavirus, severe CNS, central nervous system inflammation, and in birds younger than 4 weeks. If it is older than 4 weeks, when they pick up the virus, if it is older than 4 weeks, they will not develop the clinical signs. Okay, but in laying birds, they may show drop and egg production, but there will be no nervous manifestation. That's what I'm trying to say. In recovered birds, if birds become infected, usually the infection is transovarian, so that is the important one. The virus comes through the eggs. Transovarian infection, that's why when they hatch, they started showing these signs. If they recover, they may show cataract later on in life. So you may see blind birds, single or both eyes are cannot see, and if there is a high incidence of that, particularly in roosters, you may see drop in egg production, poor hatchability, simply because the males cannot see. They may adapt, look around, walk around and eat and drink and all that just by feeling they know where everything is, but they cannot mate because they cannot see. Another nervous manifestation in baby chicks, as I said earlier, it could be due to aspergillosis. And it can be seen in young birds, just recently had chicks, due to Aspergillus species, goes to the brain and causes granuloma like this, infection in the incubator or hatcher or within first couple days under the brooder. It goes to the brain and causes granuloma like this one. A specialist stain PS or GMS, you can see the hyphae of the fungus. Dictal area can cause similar lesion. Necrotizing encephalitis. This bird I had last year, almost a year from today, last July. These are game birds, fighting roosters, showing nervous manifestation, torticollis like this one. The photographer was not in the college, so it was a Friday, late Friday, and so I put him on the table of that camera in the necropsy room. That's why the picture turned out to be like this. Torticollis, when we open the bird, show a large number of parasites and so forth in the digestive tract and all that. And somehow I felt that this could be a protozoal infection in the brain. I don't know, I just got my gut's feeling. We took the brain for histopath, and there was this necrotizing encephalitis, massive area of necrosis, heavily infiltrated by necrotic debris and inflammatory cells, some giant cells in here. There's more giant cell inflammatory cells, some heterophils in here. On higher magnification, just looking in between, and I started to see these schizons. Schizons, so me, I thought, here we go, here's a protozoal infection. And it turned out to be Sarcosis species. And this is the first report of Sarcosis species causing nervous manifestations in chickens. It has been reported in pet birds, but not in chickens. Here's in the liver from another case where we see schizons of Sarcosis in the liver with some inflammatory reaction around them. So Sarcosis encephalitis in chickens, nervous manifestation, was a backyard chicken. Possums were suspected as the final host. Okay, there is a mistake, and it's not intermediate. Possums are the final host, sorry. The chicken is the intermediate host. Here is what we call the classic Hemorrhagic disease that I mentioned earlier, where you see one leg is stretched forward, the other one is paralyzed backward. The bird is trying to walk with a paralyzed leg, and with a good leg is trying to go forward. A classic Hemorrhagic disease. And if you look at here, it is the lumbosacral plexus. You can see it's greatly enlarged. It's usually unilateral enlargement of the nerves, either one brachial nerve, one sciatic nerve, only one-sided, one lumbosacral plexus is affected versus the normal one. And that's a classic Hemorrhagic disease. It's really helpful to know it's only one side effect. It helps a lot in the diagnosis. Histologically, you'll see a diverse lymphocytic infiltration, like small ones, large ones, intermediate ones, and the nerve. You can also see it in the brain, perivascular crop, but you don't see the neuronal degeneration or a gliosis, or at least they are not as common as in AE. So sometimes I do not see the gross lesion of the nerve, but in spite of that, I take it for histopath. Also, I take the brain for histopath, and it seems to help in the diagnosis. So, enlarged peripheral nerves, perivascular lymphocytic cuffing in the brain, spinal cord. Here's what we were talking about, the curling of the toes ventrally in young birds. They are not lateral, they are ventrally under the toe, under the foot. And that is what is called riboflavin deficiency, curled toe paralysis. When you look at the nerve is bilateral, both sciatic nerves will be greatly enlarged. And that enlargement is not due to cell infiltration as in Hemorrhagic disease, but is due to edema, as you can see here in the nerve cells. All that empty space, vacuolation, is due to edema. So, curled toe paralysis in young birds due to B2 riboflavin deficiency. Here's a nervous manifestation in chickens, torticollis of the head and neck. From the slide, it will be really tough to tell whether this is Newcastle, is it influenza, is it cholera, is it reticuloendotheliosis, is it Hemorrhagic disease, what it is. It can be a variety of diseases that can affect the nervous system. If you look at this one, you can see the facial sinuses are slightly swollen. The wattles in here is slightly swollen. This fellow has a nervous manifestation. So the combination of these signs, you're immediately going to think this got to be fall cholera, where it shows the chronic form, localization in the sinuses, in the wattle, or in the middle ear, may add extended to the cranium and the meninges, caused by Pasteurella multacida. Heterophilic meningitis can be seen and these birds with nervous manifestation. When I move to the eye, what you're looking at here is caseous material under the eyelids covering the eyeball. Same thing here. If you look in the oral cavity in the esophagus, you'll see these white pimple-like nodules in the oral mucosa as well as in the lining of the esophagus. And that is classic vitamin A deficiency. You'll see the gaseous material here simply because of squamous metaplasia and keratinization of the lacrimal duct. So there will be impaired lacrimation and will be back up and become caseated in here. Vitamin A is also involved in vision, and that is retinal is a component of the visual pigment in the retina, and its deficiency results or causes a blindness or xerophthalmia. Looking at turkey, young turkey with pus in the eye chamber, this is called panophthalmitis. Panophthalmitis. We see it sometimes in turkeys, in chickens, in other birds. I've seen it in emus. Usually when there is early yolk sac infection, septicemia, and then the lesion and the bacteria go and localize in the eye, causing pus in the eye. Salmonella, E. coli have been isolated from these cases. So it's septicemia followed by localization. Various bacteria can be isolated. Here's a mature chicken that was infected with AE in early age. So it's a recovered bird from AE, and that is cataract. Other causes of cataract are vitamin E deficiency in turkey embryos and continuous high intensity lighting. Looking at the eye, looks like a ground grass-like kind of. The conjunctiva is congested. This is called ammonia blindness or ammonia burn. Some people call it keratoconjunctivitis. It's due to excessive levels of ammonia in the air of poultry houses. These are due to poor ventilation, especially in winter. The vents are closed, the windows are closed, and curtains are down, and they don't ventilate the houses. So there'll be so much ammonia in the litter that causes irritation of the eye. Here's the pupil. Here's the iris, and you see that kind of white discoloration in the iris, and the pupil is indented. Is not the perfect circular pupil. This is Marek's disease. Marek's disease, and this white band is due to lymphocytic infiltration in the iris that started to compress, and the pupil causes indentation like this. Eventually, the pupil will become very small. Some people call it fish eye when it becomes just like the fish eye elliptical thing. Marek's disease can also affect the pupil. This is a very recent observation, maybe 3-4 year old, something like that, or at least that's what I am aware of it. I got this bird maybe 4 years ago, and it turned out to be Marek's disease. Excuse me. So, Marek's disease is caused by herpes virus, and when the eye is involved, when the nerve is involved, and the skin or muscles are involved, that will help us in differentiating it from lymphoid glycosis. Here is the bursa of Fabricius, the bursa, and there is this yellow caseous exudate filling the bursa. Should not be confused with inflammatory exudate. Histologically, you can see that there is some atrophy of the follicles in here, or the bursal follicles, but the lining epithelium and gone, squamous metaplasia, and keratinization. This is not very widely known that vitamin A deficiency can cause lesion in the bursa of Fabricius like this. There is atrophy in here of the follicle, squamous metaplasia, and keratinization of the lining epithelium. And this is vitamin A deficiency. Here is a normal bursa of Fabricius. Here is one enlarged due to edema. Maybe the edema is not very clear, but just bear with me for 1 second. I'll show you another one. And here is a small bursa, small bursa. So here is a normal. The bursa went enlarged in size and then atrophied. Here is the edema that I'm talking about, just like yellowish brown, transparent, rusty-like edema. It's unfortunate, it's not very intense color to be more clear than what I'm showing here, or at least that's the best I can do. The edema is transparent, and there is some discoloration in here. You can see it. It's just surrounding the whole bursa. This is called infectious bursal disease, just a classic example of infectious bursal disease. Here is a normal bursa histologically. Here is the cortex. Each of these is called follicle. The bursa has many pleca or a plica inside them, many folds. Okay, and each fold, here is a fold. Okay, there is a fold, consists of several of these follicles. Okay, each follicle has a cortex, these dense lymphocytes, the medulla, which is a kind of slightly less intense, kind of loose lymphocyte, and there is the zone between them, corticomedullary zone. Okay, well, the IBD, infectious bursal disease, is commonly known as, or used to be called Gamboro disease, because it was discovered in Gamboro and Delmarva Peninsula in the USA. It's caused by burnovirus. This virus attacks lymphocytes, so it's lymphocytal. Okay. Histologically, then we're going to see is necrosis of the lymphocytes, both in the cortex and the medulla. There will be disruption of the tissue. You cannot tell where is the cortex, where the medulla. So there is corticomedullary zone is almost being disrupted. There's higher magnification. You see some pycnotic cells, these dark stained cells, cardiorexis and cardiolysis, go higher magnification. Severe necrosis, edema. Some inflammatory cells going to come and engulf, clear up the mess in here. So that's an early stage where you see all that inflammatory edema, inflammatory cells engulfing these necrotic tissue. Later on, after being cleared and all that, the center of the follicle becomes like this. This is what's called cystic cavitation. At the same time, there will be fibrous tissue proliferation between the follicles. Remember, before the follicles were closely adherent to each other. Now they are separated by all this fibrous tissue. So these are the terminal stages of infectious bursal disease. Once that happens, fibrous tissue and all that, the bursa will become small in size. So it increases in size maybe 3-4 days after infection, and then by maybe another 3-4 days after that, start to go down in size. Enlargement is due to the edema. There are two forms of infectious bursal disease infection. There is the subclinical one, which occurs in bird younger than 2 weeks of age. This is more significant than the clinical disease. This is because it causes immunosuppression, will predispose the bird. Remember, we talked about gangrenous dermatitis, or we talked about what else? We talked about immunosuppressive diseases. What disease we talked about? Gangrenous dermatitis. I remember the one we talked about a few minutes ago. Okay, is it predisposed by infectious bursal disease? Immunosuppression will get poor response to vaccines later on because the B cells are damaged. The bursa of Fabricius is damaged, so the birds will not respond properly to vaccination. Clostridial infection, maybe staph infection, adenovirus. That's the other one I talked about inclusion body hepatitis is also predisposed by IBD virus. So birds will not die during the first 2 weeks when they become infected. That's subclinical, okay? The clinical disease occurs in older birds, so it occurs in birds older than 2 weeks, maybe 2 to 18 weeks of age. Commonly we see it around 6 weeks, 5, 6 weeks, something like that. And birds will die at the time of infection, so at the time of bursal damage, 3, 4 days they'll die. And we can see lesions of IBD on them. Okay, we are looking here at a chick that was 13 or 14 days old. The one in the middle is normal. These black spots, unfortunately, were caused by the saw. That's when I cut the bone longitudinally. The saw causes these spots, black spots in it. What I'm trying to show here is that here is a normal bone marrow. And what you're looking at, this one is pale, fatty bone marrow. Together with other lesions in these birds, I'm going to show you some of them now. This is called chick anemia virus. It's unclassified, has not been classified yet. This falls between two families of viruses, so they haven't settled on where to put them. So it's stayed unclassified virus. It causes damage to the bone marrow, causes damage to all cell lines in the bone marrow. Here is the thymus. This bird is exactly the same age of this one, okay? If you look at the thymus here, this is a normal bird. The thymus in these birds are very small in size. The bird himself or herself are smaller than normal birds at the same age. Here is the thymus. I separated the skin. Here is the normal thymus, while here always left is a thread of fat and maybe remnants of the thymus in there. So primarily that chick anemia virus will attack T cells in the thymus. It will also attack the bursa. Let's assume this is a normal bursa, then the bursa of birds with chick anemia virus will be smaller. It will be less affected relative to the thymus. The bursa will be less affected than the thymus. Here is a normal bone marrow. You can see like heavy, diverse population of cell lines. Here is the one from chick anemia virus. It's almost wiped out. There are no much cells, and instead there are fat actors, a few cells here and there. That's what it does. It excuse me. It causes damage to all cell lines in the marrow. The blood will be watery. The hematocrit will be low. Anemia, as the bird is very anemic. That's why sometimes it's also called infectious anemia, or at least I've heard of that, infectious anemia. Here is a spleen from a pheasant. You can see areas of necrosis, areas of hemorrhage. This is called marble spleen disease. On histopath, you can see these characteristic inclusion bodies, intranuclear one. They push the chromatin of the nucleus to the outside, so they look like signet ring. It's caused by adenovirus 2. We mentioned that earlier, related to splenomegaly in chicken and hemorrhagic enteritis in turkeys. Adenovirus 2 in pheasant splenomegaly. It is a bursa of fabrices. What you can see is that the lining epithelium is increased in size. There is hypertrophy. Some structures here covering the surface epithelium, like round structures. These are cryptosporidium. Cryptosporidium may cause some mucus, some enlarged bursa, and histologically you see the parasite on the surface epithelium, just on the surface. Some people consider it significant, others they say, I don't know. And I'm that group, I don't know whether this is significant, or there is some mucus, there is some, in the bursa there are some inflammatory cells, but how significant is that? That's what I'm trying to say, I don't know. Cryptosporidiosis, Cryptosporidium species. In addition to the bursa, we sometimes see it in the respiratory epithelium, or brush border, sometimes in the intestine. Where's significance? I don't know. This is a budgerigar, and what we're looking at here is the thyroids. They're greatly enlarged in size, and that is characteristic of goiter, which these birds are very susceptible to. Budgerigars are very susceptible to goiter. They are fed seeds without much source of iodine. That's why we advise to give some drops of iodine in the water, maybe once a week or so, as a source of iodine. Deficient budgerigars, the iodine deficiency will cause enlargement of the thyroid like this. It will start compressing the trachea, the esophagus, and the major blood vessels of the heart. So clinically there will be regurgitation, respiratory problems, and tachycardia. Excess iodine can cause similar lesions, but it's very rare to see colloidal goiter. Most commonly is iodine deficiency. Respiratory signs, tachycardia, regurgitation maybe. I'm going to move to the reproductive system, and what you're looking at here is misshapen eggs. All these eggs with the grooves and ridges and abnormal shape. Here is eggshells that are very thin, paper thin, some of them collapse, some of them just the paper shell, skin shell, some people call them. And this can be caused by a variety of things. Could be calcium deficiency, phosphorus, vitamin D, associated with osteoporosis. Infectious bronchitis can cause these ridges on the eggshell, copper. Adenovirus 3, adenovirus 3, which we called earlier egg drop syndrome, can cause eggshells like these. So it's a variety of infectious, viral infections, most of them, or nutritional deficiency can be the cause of these misshapen eggs. Here we are looking at a large-sized egg, is small versus a small one. When you break this, there are double yolk in this, there is no yolk in this one. This is called double yolk egg and is mostly seen at the peak of egg production, which in laying chickens around 28, 27, 24, depends on their management system and when do they start egg laying, lighting system and so forth. It's around 27 weeks of age or so. It's under hormonal influence where two yolks mature at the same time and are processed as one egg. This one is called peewee egg. Peewee eggs that do not have yolk. There is something just like this one here, this equamated epithelium or cageous material in the oviduct from early infection at younger age stimulated the wall of the oviduct to produce that albumin. Otherwise, normally the yolk is the one that stimulated the oviduct to produce the albumin, and then the shell membranes will develop around them and funnel the eggshell. These are not for table, these are just sell them for the schools for kids, making drawing of them and all that. This is for table only. They will not hatch if you incubate them. There is no enough nutrients for both embryos. Commonly asked that by students. So they will not hatch. Double yolk versus peewee eggs. What you're looking at here is a laying hen, or used to be a laying hen, with all this yellow, cheesy, cageous material in the abdominal cavity, covering the intestine, the lining of the visceral organ. The ovary is here. This is called egg peritonitis. egg peritonitis. So what is happening is that the follicles get ruptured, and normal it happens the follicles may rupture and the yolk will be absorbed, okay, if there is no bacterial infection. But in the presence of bacterial infection, the yolk, the ruptured yolk that has been escaped in the abdomen, will become caseated like this. Bacteria that is either ascending from the cloaca went up into the oviduct, or systemic infection that came eventually to the ovary, causes rupture of the ovarian follicle and causing caseation of the escaped yolk. So the infection is either ascending or following septicemic bacterial infection. Here is broiler chicken with this cyst-like structure on the right side of the bird near the cloaca. Here is another shot of a very large cyst. It can be small or very large like this one. This is called right cystic oviduct. So obviously it's in a female chickens. It's commonly seen at necropsy. Has no significance if it was small, but if it's large like this one, it becomes a space-occupying lesion. It starts compressing the guts, the intestine, pressing the oviduct. The bird may go out of production. Normally the chickens has two oviduct, two ovaries, but only the left one that developed. The right one remains rudimentary. From outside it looks like cyst like this, so it looks like ascites. Should not be confused with ascites. That's because of a big cyst. This was a laying chicken. So that cyst still contains in its structure its wall glandular tissue that continues to produce fluid and eventually becomes so large. And here is a laying chicken. I counted, I think, 42 eggs that were sitting free in the abdomen. This is called abdominal ovulation, where you see yolks either semi-developed, they have some shell around them, or they are just pure yolks sitting free in the abdomen. What happened is that this egg has went into the oviduct some distance, and then reverse peristalsis came back. This is due to damage in the oviduct and becomes impacted, and the birds continue to produce yolks, but they don't go into the infundibulum, they do not go into the oviduct. Instead, they'll stay free in the abdomen. It's called abdominal ovulation. Sometimes you may see a completely formed egg with a thick eggshell and so forth in the abdomen, and that means that that egg has reached the uterus where the eggshell is being formed. But it either came back by reverse peristalsis of the oviduct, or there was a rupture in the oviduct wall, and that's through which the egg escaped and settled in the abdominal wall. Early infection with E. coli, Salmonella mycoplasma, and I remember infectious bronchitis. I say some strain affect the kidneys, some strain causes damage of the uterus, infectious bronchitis. So early age infectious bronchitis or mycoplasma can cause damage to the oviduct, which results later on in abdominal ovulation. Here is the ovary of a mature hen. The ovary looks like cauliflower, and that is characteristic appearance of Marek's disease. Marek's disease. Histologically, you will see lymphocytic infiltration between the ovarian follicles. All the cell infiltration between the, more or less characteristic for Marek's disease. We talked about Marek's disease before. What are you looking at here is a prolapse of the oviduct. It's a very severe case. And usually when that happens, it's going to pull out the cloaca, and part of the intestine comes out with it too. We usually see it in obese hens at early stage of egg production. When a large egg is produced by a hen that is laying for the first time, the tissues going to come out with it. Prolapse of the oviduct. Sometimes this is so mild, just barely everted vaginal mucosa is showing. It is the oviduct from a chicken, and you can see this mass is attached to the mesentery of the oviduct. This is leiomyoma. It has no much significance unless this neck or that tissue becomes so pedunculated, so long, and start to wrap around the oviduct or wrap around the intestine, and that's when it's going to compromise these tissues. Otherwise, it has no significance. Here is a normal yolk sac in a baby chick. Here is the Meckel's diverticulum. Here is a small intestine, almost the mid of the intestine. That's how it is attached. There's normal livers from these baby chicks. Usually they look fatty, yellow. They still live on the yolk. Whenever there is yolk sac infection, however, there will be a change in the content of the yolk sac. It will be caseated, turbid. The yolk sac wall itself is kind of congested. The same here, change in color, congestion. The liver will be also enlarged, some congestion in here. The gallbladder is engorged because the bird is not eating. Thus, yolk sac infection is commonly associated with encephalitis as well, navel ill. It can be caused by a variety of bacteria, or a variety of bacteria being isolated a variety of bacteria being isolated from birds with encephalitis, including Salmonella, Staphylococci, Proteus, E. coli, other bacteria. It's generally associated with dirty hatching eggs, poor sanitation in the hatchery.